Nolan could chair at the beginning, and Ken could chair at the beginning.
Order, please. Order, please. The Subcommittee on Supply will come to order. It is now 3:41 p.m. The subcommittee is meeting to consider the estimates for the Department of Addictions and Mental Health as outlined in Resolution E27. Resolved that a sum not exceeding $306,855,000 be granted to the Lieutenant Governor to defray expenses in respect of the Office of Addictions and Mental Health pursuant to the estimate. I will now invite the Minister of Addictions and Mental Health to make opening comments up to an hour, and if they wish, introduce their staff to the committee. And just a reminder that the Minister can only be aided directly by 2 staff from the department. I recognize the Honourable Minister of Addictions and Mental Health.
Thank you, Mr. Chair. Thank you for everyone for being here this afternoon. I'd like to just introduce my staff to start off. So to my right is Kathleen Trott, Associate Deputy. To my left is Barry Burke, Executive Director of Finance. Then behind me I have my Senior Advisor, Ken Carmichael. Does a lot of hard work for many people. Francine Vesna and Natalie Cochran. So thanks to them for coming today. Mr. Chair, I'm pleased to be here to highlight the work of the Office of Addictions and Mental Health, to speak about the group for our priorities for the coming year. We had many exciting and critical projects planned for the year ahead that will build upon the accomplishments of the past year and provide more care for those in need. Budget 2023 helps move our province forward, investing in healthcare and many of the things that are important to Nova Scotians. We will do whatever it takes and invest what it takes to fix healthcare and deliver the care Nova Scotia families need and deserve. This budget builds on our work so far and moves us forward. Our investments will put us on a long-term path of growth so that we have a sustainable healthcare system. And more importantly, so that Nova Scotians can get the timely, reliable mental health services that they deserve. We have a real plan to fix healthcare, and it's working. We are making progress, but just as the issues did not emerge overnight, it will take some time to resolve. Delivering universal mental health and addictions care is no small task, and it's not something that can be defined by one single action. We are addressing gaps in care. We are supporting critically important programs delivered in communities. And we are testing new and better ways for people to get the help that they need. These actions are providing more care for Nova Scotians today. They're also building the foundation of universal mental health and addictions care, where all Nova Scotians, regardless of their income, have access to the support that they need. Universal care is a made in Nova Scotia solution. It will be the first of its kind in the country, and it will take time to put all the pieces in place. We've been quite open and honest about that since the beginning. While we admit that there's still a lot of work to do, I don't want to give the impression that care isn't there for Nova Scotians today. I can assure you it is. There is a tremendous care that is being delivered in every region of the province. Nova Scotians should be encouraged and inspired by the incredible efforts we see from frontline workers, from our community-based organizations, and many others. During my time as minister, as well as my time as working on the front line of addictions and mental health care in Cape Breton, I've had the opportunity to see firsthand the tremendous work and dedication of so many who work tirelessly to help those living with mental health and addictions issues. I want to acknowledge the unwavering dedication of so many of the front lines and the difference that they are making in the lives of so many people. Many Nova Scotians have found hope, strength, and success thanks to the care delivered by these dedicated workers. But we certainly know things aren't perfect. There are Nova Scotians who are still having trouble getting the care that they need. This is what still keeps me up at night, and I know it keeps many other families up as well. I want to assure them and all Nova Scotians that we are there for them and that we will not rest until the work is done. We will do more and go faster to deliver the health care that Nova Scotians deserve. I'd just like to take a couple minutes to speak about how the Office of Addictions and Mental Health works. So the office is responsible for setting the strategic direction and for funding the delivery of addictions and mental health care in the province. We maintain a strong connection within the Department of Health and Wellness and across the broader health system itself. We work alongside our colleagues in education, justice, and housing, community services, to network on solutions that make a positive impact on the health and well-being of Nova Scotians. The office also works closely with Nova Scotia Health and the IWK to deliver a range of care for people living with addiction and mental health concerns. We also partner with numerous community-based organizations to support the delivery of important services in communities, services that promote mental wellness and help people overcome mild and moderate challenges that impact their mental health. We are also responsible for ensuring Nova Scotians understand how to access the care that they need, that access to multiple services is streamlined, making the system easier to navigate, and that there is consistency and integration of practices across the 4 health zones. None of what I just listed would be possible if not for the hard work and commitment of the team of employees within my office. They've definitely been working hard, and I'd like to acknowledge all the work that they have done. Mr. Chair, we've been delivered a significant and critically important mandate. And I certainly speak for the team when I say that we are eager to continue our important work on behalf of all Nova Scotians. Over the past year, I've been right to Yarmouth, to Sydney, and everywhere in between. Certainly it's been a privilege to travel the province and hear the unique needs of communities. There's certainly some significant challenges in the provinces, but some significant opportunities. I certainly learned that communities have diverse needs. On my travels, I've met with clinicians, community-based organizations, and their dedicated staff and volunteers. Good mental well-being of Nova Scotians is a team effort. In addition to having responsibility and oversight of addictions and mental health, I also have the responsibility for Communications Nova Scotia. So I'd just like to acknowledge the deputies and associate deputies and senior teams for the preparation that they do with this budget and submissions and their hard work throughout this past year. Our budget for addictions and mental health for 23-24 is just over $300 million, a $38 million increase, or 14.2% compared to last year. The office's budget is focused on advancing our commitment to Nova Scotians to improve access to mental health and addictions care, as we've laid out in our Action for Health plan, including investments and projects to further advance universal care, projects that will build our mental health and addictions workforce, deliver culturally representative and responsive care, and test new and better ways of offering care. Before I dive too deeply into their budget, I just want to speak a bit to our partnerships and investments. Care is delivered to Nova Scotians through health authorities, community, and private partnerships. Collectively, they help to promote individual mental wellness, support people experiencing mild to moderate health, substance use, or gambling concerns, and support for those who require more intensive care for more severe and complicated disorders. We've made investments over the past year to expand care in all of these areas. Recently, we provided over $7 million to support critically important community-based programs. Throughout the year, we hear from many organizations who are experiencing hardship. The cost of inflation has impacts right across the board. Higher operating costs, coupled with fewer fundraising dollars from Nova Scotians who are simply not in the position to give as they once did, has meant that these organizations, and more importantly, the people who rely on them, need our help. And again, this year, we were grateful to be able to offer that help. For a second year, we've continued with an unprecedented investment of $3 million to the Mental Health Foundation of Nova Scotia for community grants. Last year, the foundation was able to support the important work of numerous organizations across the province, including a project by Love Nova Scotia that enabled 40 youth to build their capacity as positive role models in their communities and with their peers. Grant funding also allowed Healthy Minds Cooperative to support members of the 2S LGBTQIA+ community in becoming Safe Talk trainees. These trainees are now helping others within their community who might be struggling with thoughts of suicide. Wabanaki Two-Spirit Alliance was also supported through provincial grant funding administered by the foundation last year. Funding allowed these organizations to hold gatherings where Two-Spirit youth and young adults were able to share their thoughts on how best to address their mental health needs. We will continue to support the delivery of community-based mental health and addiction programming, and we will seize the opportunities to further expand access to services for people who need less intensive support than is currently offered in the formal healthcare system. Services like those, the recently launched peer support line, almost 400 Nova Scotians have already reached out for support since the line opened last fall. Peer support can play a critical role in helping Nova Scotians overcome addiction and mental health challenges. The line offers a safe space for Nova Scotians who are struggling. Being able to connect with someone who has been where you are and who can relate with empathy can really build confidence and hope. Peer supporters are accredited and certified with national training. They provide social and emotional support, reassurance, and encouragement to people who are feeling isolated, alone, or anxious. They can also provide information about more formal services and supports that might help. Another recently launched service that is helping Nova Scotians deal with mild to moderate mental health concerns is a program called Tranquility. So Tranquility was a program actually founded by Nova Scotian Joel Muse. He was a financial planner initially, started to have some mental health issues himself, and kind of, well, worked with the psychologist in Nova Scotia and developed this innovative program really coming from lived experience. So it was a great partnership for a really well-utilized service. The online program helps better understand their emotions, thoughts, and behaviors, and build skills and coping strategies. People are supported by a coach who checks in on their progress and offers ongoing help and motivation. Almost 2,000 Nova Scotians have used the program since it launched in December, including one Nova Scotian who says he needed non-crisis anxiety management to help him tackle some professional and social hurdles in his life. For him, having direct human contact and personal accountability were key, as was the fact that he could access to this program for free, something he says he otherwise wouldn't have been able to afford. In his own words, "My coach isn't a therapist, and I don't dump therapy level stuff on them, but I'm finding it helpful just to have someone to talk me through my thought loops and challenges, and to have a place where I can write my struggles down and evaluate them rationally." These same outcomes are being experienced by people who have used Access Wellness. Many of us at some point in our lives experience life stresses that challenge our ability to cope. It could be a job loss, the loss of a loved one, separation or divorce, or family conflict. Having professional help readily available will keep us mentally well and help address the problems early before bigger mental health issues develop. Not only are peer support line, Tranquility, and Access Wellness universally available, but Nova Scotians can access these directly without a referral of a family doctor or general practitioner. They are providing a level of support that Nova Scotians haven't previously had access to. Support to help them through everyday life challenges, and support that can keep people from potentially needing more intensive supports. These services are addressing gaps in care. They are making more accessible, and most importantly, they are making a difference in the lives of Nova Scotians. People who require a lower level of support aren't likely to benefit from the more intensive and specialized care that is delivered in the formal healthcare system. In fact, by labeling a person's distressing emotions as suffering in the face of real-life stressors as a mental illness, sometimes we can do more harm than good. People who are struggling need support. They just might not need formal mental health treatment. And that is the gap we're helping to address with these new services. Mental health is certainly complex, and challenges require a wide range of care. While our community-based partners deliver care for Nova Scotians dealing with mild to moderate concerns, Nova Scotia Health and the IWK provide care for people with more specialized and severe concerns. The care delivered by our health authorities include in-depth diagnostic assessments, medications, psychotherapy, intensive interdisciplinary care involving occupational therapy, recreation therapy, and social work case management, as well as others. It's within this level of care that you will find inpatient care, intensive mental health and addiction day treatment programs, outpatient clinical services, and specialty care for illnesses such as eating disorders. We need to continuously be looking for ways to improve the delivery of care and ensure we are meeting Nova Scotians where they are in the recovery journey. We know there are many people who don't require around-the-clock inpatient care and can safely and successfully recover from mental health and addiction issues while remaining at home and within their own community. This year's budget also includes $4.9 million to enhance addiction medicine services, including further expansions of the province recovery support centers to the Strait Richmond area, Sydney, Yarmouth, Truro, North Sydney, and Halifax. The 4 existing centers have already supported more than 1,000 Nova Scotians in their recovery. These centers improve direct access to support for people living with substance use and gambling disorders and provide a bridge to increased or decreased level of care based on their individual circumstances or needs. Just as the recovery support centers provide outpatient care to those struggling with substance use and gambling addictions, the province's new mental health day hospital provides a similar pathway to support for people requiring intensive mental health treatment. This year I had the privilege of visiting the province's first mental health day hospital here in Halifax, where I had an opportunity to meet the dedicated team of clinicians who were excited to be part of this new model of care. The new day hospital at the Cape Breton Regional Hospital will provide another level of access to patients on the island, and there's great excitement among local clinicians with this innovative model of care. We know that successful health outcomes depend on the ability of Nova Scotians to access appropriate supports and treatments. Before the opening of this hospital, the only pathway to intensive mental health treatment was to be admitted to an inpatient psychiatric unit. But not everyone needs around-the-clock hospital care. The Mental Health Day Hospital addresses this gap and provides another way of delivering intensive mental health treatment, while allowing patients to stay closely connected to their families and communities. Patients are supported by an interdisciplinary team of mental health specialists, including a newly hired psychiatrist, nursing staff, and social workers. They attend therapeutic group programs and receive psychiatric treatments during the day and continue their recovery at home in the evenings and on weekends. Inpatient acute psychiatric units in Nova Scotia are functioning with high occupancy rates. This means that some people can't get inpatient care close to their homes. Transferring patients to facilities in other zones places them further away from their families and support networks and places great strain on these facilities. These interfacility transfers also reduce the number of ambulances available to respond to other health emergencies and other patient transfers. These impacts can be costly, inefficient, and most importantly, they aren't meeting the care of Nova Scotians. Mental health day hospitals help to alleviate these pressures and free up inpatient psychiatric beds for those with more severe mental illness. This is why we are investing in an expansion of the day hospital, adding one in each of the remaining health zones across the province. This year's budget includes just over $2 million to support this expansion. The services I've been speaking about are in place now. They are providing care to Nova Scotians today, but we know our work isn't done. More needs to be done to give Nova Scotians the timely, reliable mental health and addictions care that they need. A significant portion of this year's budget will be invested in testing new ways of delivering care, taking the best ideas and putting them into practice. More than $1 million will be invested to expand training opportunities for clinical psychologists and provide more access to clinical care for Nova Scotians. Students of Dalhousie's University Clinical Psychology program will work under the supervision of registered clinical psychologists. This will allow these students to enhance their training while also positioning them to deliver a range of clinical services to those that need help, ranging from assessment to clinical intervention and group psychotherapy. The office budget also includes $306,000 to support a new pathway for Master of Nursing students into mental health and addictions care, helping to expand the workforce and provide more care faster to Nova Scotians. The Dalhousie School of Nursing currently offers 2 streams for advanced practice, the nurse practitioner stream and the professional stream. By offering advanced practice in mental health and addiction, we can train more nurses to work in the field and ultimately better support Nova Scotians who are dealing with mental health and addiction concerns. Our budget also includes $250,000 to expand access to needed diagnostic assessments for ADHD and autism spectrum disorder through partnerships with private practitioners. This will help Nova Scotians to get important diagnosis and treatment sooner and allow us to test aspects of universal care model, including compensation. This year's budget also includes just under $2 million to establish integrated youth services, providing youth with seamless care and better mental health supports. 8 locations will be set up across the province over the next 4 years. These locations will offer a single point of entry for young Nova Scotians and their families to support access needed and services that they need, including peer support, referrals, navigation, and direct connection to resources within their communities. Healthcare and social service providers will work together with youth and families to develop a care plan tailored to their unique and individual needs. Now I'd like to take a minute just to speak about the importance of community. More specifically about the importance of ensuring that our own mental health and addiction services represent and respond to the needs of diverse communities. I have on several occasions had the opportunity to meet with the executive directors and health directors of community organizations and community health centers in various Mi'kmaq communities. I've also met with the staff at the Mi'kmaq Native Friendship Center and with Tejikamic to discuss mental health and addictions issues among Indigenous people and increasing resources within their communities. What these and other visits have taught me is that the need to truly engage within the community. This year, we will be investing in targeted work to design culturally specific services for African Nova Scotians. This work will be led by the African Nova Scotian community, with the aim of enhancing trust and confidence in mental health and addiction services, strengthening cultural representation, knowledge, and competence amongst our service providers, and improving community health. This investment will lay the groundwork for the development of supports that are guided by the cultural and tradition of the people they are intended to help. We know that the needs of diverse communities have been underserved in our healthcare system. We also know that the best ideas come from people who have experience. It is when people are faced with the barriers they see that they can see the solutions. We have been engaging with African Nova Scotians and with members of Indigenous and 2S LGBTQIA+ communities in our work to develop universal care. These engagements have been tremendously valuable in helping us to identify what's working and where our gaps are. The only way we can better meet the needs of these communities is by better understanding them. We will continue to work with these communities over the coming year and test new models of delivering care that is led by them and their needs. So I've talked a lot about mental health so far, so I'm just going to switch it up to talk about some addiction supports. I also want to clarify that the two are not distinctly separate. Quite often people who are dealing with addiction concerns are also dealing with mental health concerns. And sometimes people who are dealing with mental health concerns will turn to substance use as an escape. So essentially what we've been talking about today so far is a crossover between both mental health and addiction. But there are a few specific items in this year's budget that are uniquely focused on delivering care for people with substance use issues. In addition to the expansion of the recovery support centers across the province, which I've already talked about, we also support several different types of harm reduction programs, including needle exchanges, overdose prevention sites, naloxone, and managed alcohol programming. This year's budget includes $1 million to support the managed alcohol program at the North End Community Health Center and to expand the programming to the Eastern Zone. These programs provide essential supports to people living with alcohol use disorder, preventing alcohol-related harms, including withdrawal, which can be extremely dangerous and often life-threatening. Organizations such as the Ally Center and Direction 180, which I had the opportunity to personally visit myself, do tremendous work for Nova Scotians. This year's budget also includes additional investments in the Mobile Outreach Street Health Program, which provides accessible healthcare services to people who are experiencing homelessness or who are insecurely housed. We will continue to look for ways of better supporting people on the road to recovery. Everything I've spoken about today is delivering on our promise of working towards universal care, care that is available at the right time and the right place. This can sound very simple, but we all know that this is a substantial piece of work. We are breaking new ground. We don't have the luxury of leaning on lessons learned from other jurisdictions. We need to build this from the ground up. And that is what we have been doing since we came into office. We continue to work tirelessly to address gaps in care. We're supporting critically important programs delivered in communities. And we're testing new and better ways for people to get the help that they need. These services are building the foundation of universal mental health and addictions care, where every Nova Scotian will have equal access to the mental health and addictions care that they need regardless of their situation. Is there more work to do? Absolutely. We will not rest until it's done. Thank you.
Thank you to the Minister. I would now like to recognize the Honourable Member for Clayton Park West. So according to the practice that is developed in this legislature, each caucus has about 1 hour to start with questions, has 1 hour to start. I will take my seat on behalf of the NDP caucus at the end of your first hour. Only the Minister may answer questions, of course. And as well, caucus are expected and encouraged to share the time fairly with the independent member. So at this point, I would recognize the Honourable Member for Clayton Park West to start their first hour of questions.
Thank you, Madam Chair, and thank you to the Minister for the long speech and lots of information. I have a few questions, but I'm going to start with the prepared questions, and if we have time, I'll go back to a couple of the things that you said in your opening remarks. So I'm going to start with numbers, if you don't mind, and I'm just going to go line by line from the budget. Just so I'm starting actually my first question. We see that the budget has increased from 2.2 to 2.6 with an increase of 5 FTEs, full-time positions. What were these positions for? If you can just give us a list of those.
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. So these 3 positions would be for a senior strategist, a coordinator, and a senior policy analyst. A senior strategist, a coordinator, and a senior policy analyst. And their primary objective, I'd say, and goals within the office would be to continue to work towards the mandate for universal access to addictions and mental health care.
So these are 3,
I recognize the Honourable Member for Clayton Park West.
Thank you, Mr. Chair. So these are 3 full-time positions, and it says 5. So there is 2 more, or is that? It shows 5. Oh, yes, it is. It gives a number of extra positions, FTEs. It went from 19.4 to 24.
I recognize the Honourable Member for Addictions and Mental Health.
Thank you. So estimate to be 3 new positions. I think the 19.4 would have been a pre-existing vacancy, so there'll be 3 new positions in total. Yeah.
I recognize the Honourable Member for Clayton Park West.
Thank you, Mr. Chair. The second question under operating costs, there is an increase of 600,000. Can the minister explain what the increase is made up of? That's operating costs.
I recognize the Honorable Minister for Addictions and Mental Health.
Yeah, so the primary reason for that increase would be primarily inflationary pressures. So rental fees for clinical services to deliver a service, as an example, to increased inflationary pressures. There might be a small amount of wage increases too amongst clinicians too. Yeah.
I recognize the Honorable Member for Clayton Park West.
Thank you, Speaker. Third one, under the grants and contributions, there was an increase of 13 million. Can the minister tell me what are the grants and who the contributions went to? If we can have some names of organizations as well.
I recognize the Honorable Minister for Addictions and Mental Health.
So yeah, thank you, Mixed Chair. So there's a variety of groups that would have received money. So just for clarification, you're talking about the annual core funding organizations, or just the recently?
I recognize the Honorable Member for Clayton Park West.
Just to clarify, if it is a long list, if you could give us that information in writing, but just read it quickly, and I will but we would like to take it home with me as well. Thank you.
I recognize the Honorable Member for Addictions and Mental Health.
Thank you, Mixed Chair. So I'll give a couple examples of ones that we would do like every year, and then some other ones that would be the newer, like one-time examples, if that works. Or do you want?
I recognize the Honorable Member for Clayton Park West.
Thank you, Mixture. Do you have the list? If you have it, we'll just like a copy of it by the end of that's all. Thank you.
I recognize the Honorable Member for Addictions and Mental Health.
Yeah, so I think I just would like to acknowledge a couple of the groups, just because I think that they're doing great work. So I think Aiden's Place in Yarmouth is a great example of such an organization which provides services to youth in transition to skill building for employment, for example, for suppers. That family specifically had a very sad story of a child of their own from suicide. So I know they do a lot of good work in the community. I think Ally Center in Cape Breton is certainly another organization that does great work with vulnerable populations, certainly in Cape Breton. So they do everything from evidence-based harm reduction to managed alcohol withdrawal to employment sort of services. So I think that's a couple good examples, if that's, yeah.
I recognize the honorable member for Clayton Park West.
Sorry, Mr. Chair, maybe I wasn't clear. If you can give us the dollar value that to each organization, is that what you have? Well, what I'm looking for is the dollar value out of the 13 million, who got what, and if you have those, well, we can take, you can table them, and then we'll take that. That would be wonderful. Thank you.
I recognize the honorable member for Addictions and Mental Health.
So there's a number of programs, so you just want them to receive the list with the money. I can list them. Okay, so the Strongest Families, the IWK received $245,000, Kids Cell Phones, $300,000. So and we can provide the list at a later date with the specific amounts. Okay, thank you.
Thank you.
I recognize the honorable member for Clayton Park West.
So, question 4, I'm just going through the line, and we go through it fast. General administration has decreased in costs. Can the minister tell me what decrease consists of? Just the general. Did we lose a staff? Sorry.
I recognize the honorable minister for Addictions and Mental Health.
Thank you, Mr. Chair. So there's a partial vacancy in the office, within the office itself, so that would be where you would see that reduced cost. Yeah.
I recognize the honorable member for Clayton Park West.
Thank you. So I'm assuming this is going to be filled, this position. It was just vacant at the moment. Okay, vacancy. There is also 2.8 million for strategic direction and accountability. Can the minister tell us what this line item entails? Just a breakdown. I don't think we've had that before.
I recognize the honorable minister for Addictions and Mental Health.
Thank you, Mr. Chair. So this would be primarily the financial contribution for the Office of Addictions and Mental Health, the staff that carries the bulk of the mandate and the strategic direction. Thank you.
I recognize the honorable member for Clayton Park West.
So this is salaries for a number of staff in the department. How many staff, if you may give me?
I recognize the honorable member for Addictions and Mental Health.
So this would be 22 of the 24 FTEs within the office. Yeah. Yeah. Thank you.
I recognize the honorable member for Clayton Park West.
So could the minister explain what early intervention services are on the budget line item? What will the increase in monies cover?
I recognize the honorable minister for Addictions and Mental Health.
Thank you. So this would be primarily for the autism model and for increases in EIBIs, the Early Intensive Behavioral Intervention Program. Thank you.
I recognize the honorable member for Clayton Park West.
So we've increased the money for the EBI. That's the 3 to 5 year old before they go to school through the IWK program, correct? Yeah, sorry, to the minister. To the chair, mixed chair, through the mixed chair.
I recognize the Honorable Minister for Addictions and Mental Health.
Thank you. So EIBI is typically for the preschool population, so I think it would be maybe a bit earlier than the 3 to 5 year range, but typically the 18 to 36 month sort of kind of cohort. Yeah.
Oh. I recognize the Honorable Member for Clayton Park West.
All right. So just for that, have we increased? Because that's a very important program that I have actually worked with as a medical interpreter, and I've watched it. But I'm hearing a lot that they're unable to get their kids into it. So have we increased the budget for that program? If you can let me know, please.
I recognize the Honorable Member for Addictions, or Minister for Addictions and Mental Health.
Yeah, so this isn't an increase for the specific question. This is a transfer from Department of Health and Wellness. We would have looked at our investments last year in the preschool strategy. There would have been a significant increase. We just recently gave Pinwheel Wellness to a facility in Bedford, a $600,000, I believe, investment, which is an incredible service geared towards autism as well. So that would be comprised of clinical therapists, occupational therapists. So Cynthia Carroll with Autism Nova Scotia kind of is spearheading that service as well. So this specific question isn't, but there has been significant, I would say, increased investment in autism. Thank you.
I recognize the Honorable Member for Clayton Park West.
Sorry, Mixed Chair, I'm a little bit confused because I thought that was a program through IWK and it had a certain budget. So is the whole money here, that what we just talked about, so we called it early intervention services, so 22.4 to 28.6. So there is an increase, but that, which is around 600, and that's the 600 that went to Bedford group. Just trying to understand what is happening with this EBI.
I recognize the Honorable Minister for Addictions and Mental Health.
Thank you. So from estimate to estimate, it's a $1.5 million increase, just for clarification. So I do think it's important just maybe give a brief overview with autism, because I think there's a few moving parts with this file specifically. So last year we did invest $12 million to implement a new model of care for preschool autism services. So that'll be implemented over the next 1 to 2 years. So these include interventions, could be diagnostic testing, could be supports for families. We recently just expanded Quick Start, so that's for parents. It's a parent teaching program to get enhanced coping skills for parents. So that's been expanded across the province now. So there's partners within the office, certainly with IWK, with Hearing and Speech Nova Scotia. I would say within the education as well. Autism Nova Scotia certainly probably one of our most significant partners on this file specifically. So I mentioned Quick Start. Pinwheel Wellness Center in Bedford is a... What's that? Oh, sorry. So Pinwheel Wellness, yeah. So that's in Bedford. I had a chance to stop by there last month. So it's a fantastic place for families. There's the brief intensive outreach service, which I think is another innovative service where a team of trained clinicians can actually go to the community, go to the household, and intervene before things kind of get to the point where families aren't left with the choice but to bring their child to the hospital setting. I think feedback from both the clinicians and families have been very positive thus far. I know we do have some preliminary data on the number of calls that service has had so far, but it's been very positive so far for the feedback we've been receiving. We did try to launch that service in Eastern Zone. It might have been before my time, I believe, in this position. But there's issues with human resource capacity, but there's been success, I think, in Northern Zone with getting that service stood up. But it was started here in Central Zone through the IWK. So the new model of preschool autism service, so that includes the Quick Start Nova Scotia expansion, which is intervention for parents, so education for parents and families, a coaching program with people that they don't need a definitive diagnosis, they can just have a suspected diagnosis. So sometimes that's certainly a barrier. On a little bit of a, I don't know, say different topic, but one of the pilots in the budget, the subcontracting with psychologists is actually geared towards increasing capacity in the province to make more diagnoses, increasing the clinical capacity, right? So that's kind of where we would look at taking that private partnership to offer a free public service where there's a wait list, right, as you mentioned, for diagnostic criteria. So we have increased annual funding from $300,000 to $400,000 for Autism Nova Scotia. There's 9 autism resource centers across the province. And yeah, I just talked about the BIOS program. So this helps healthcare providers and families handle emergency situations with children under the age of 19 with autism. So this is expanded to allow the program to be piloted in the Northern Zone, the Northern Health Zone in the province. Thank you.
I recognize the honourable member for Clayton Park West.
Thanks, Chair. So this 600,000 wasn't just for early intervention. It was for multiple different, well, you said quick start, pinwheel. Are we funding them, or these are staff positions? The EBEI, they were staff positions within the IWK, and they go to the homes and help the children at their home, prepare them for school. So that these were positions. And this, I'm confused, are these positions or are these grants or money?
I recognize the Honourable Minister for Addictions and Mental Health.
So the 600,000 for Pinwheel is separate. That was just announced in one of the one-time grant contributions because I think they were having some pressures there with operational costs. But we certainly provide some core funding for Autism Nova Scotia as well. So the actual service delivery of the BIOS program would be through clinicians, I think through the IWK. Which would be part of their, the health authority and that sort of thing. Could be occupational therapists, behavioral interventionists. They would have some contact with psychologists, I believe, at certain, so a variety of healthcare disciplines. Yeah.
I recognize the honourable member for Clayton Park West.
Thanks, Chair. I'm a little bit confused, but I'm still moving to question number 7. For addiction services, there's a slight increase in the budget. Can the Minister explain what the increase represents? That's for addiction services. We just have one more line, and then I can move on to real questions.
I recognize the Honourable Minister for Mental Health and Addictions.
Thank you, Mixed Chair. So this would be primarily for wage increases. but as also as part of the continued expansion of the recovery support centers. So there'll be, I used to work at the inpatient withdrawal management unit in Sydney, so that's kind of being changed to be more accommodating to the recovery support center model. They'll be changing some clinical programming for group programming, individual programming, these sorts of things. The site in North Sydney is actually going to be as a new site for that community. So this is going to be kind of built from the ground up, essentially. So I know there's a lot of excitement in North Sydney for that service. So that's kind of a continuation of the further implementation of the recovery support centers, which can range from connection to inpatient withdrawal services to something as simple as coming by for the group program a couple times a week sort of thing. So, yeah, thank you.
I recognize the honorable member for Clayton Park West.
Okay, so I think we've gone through most of the lines just to get the details on that. But in general, the World Health Organization recommends that government spend at least 10% of its health budget on mental health. We are spending 6% of total health budget here. So can the Minister of Health tell us why our mental health budget is not, still very small compared to what is expected or recommended? Do you expect it to go higher, or are you hoping to reach the 10%?
I recognize the honorable Minister for Addictions and Mental Health.
Yeah, it's a good question. Something I thought about a lot when I was working as a psychiatric nurse. Left that to come to do this essentially. So certainly a good question. I think this year, it's been by far the biggest increase in mental health and addictions care in the history of the province. $38 million. I've been doing this for a little over a year and a half, I guess, and it's been increased by 65 million. So I think that's pretty significant. I think I wouldn't say that it's as I wish it was as simple as getting more money to address this issue. They're very complex issues for sure. So if you look at across the continuum, I think of what does universal access mean? It can mean anything from a peer support right across the spectrum to any acute hospital admission, right? So, and oftentimes this process isn't linear. So sometimes people have to kind of go back and forth along the continuum as they need help, throughout their life. So I think when you look at innovation, I would say in the pilots, whether that's looking at clinical psychology programs or new nursing programs, or I think there's the subcontracts with private clinical psychologists. I think there's a lot of exciting opportunities there, for sure. And I think when you think of pilots, you look at, innovation, right? Innovation, evaluation, and scalability, right? So and when you're innovating, sometimes everything doesn't work, right? It's, that's part of innovation. But we're kind of offering, expansion of services, many of which are the first of their kind in the province. I think when you look at the expansion of the acute mental health day hospitals, to Cape Breton and to the northern zone and to the western zone, sort of increases to, more intensive services for sure. So I would say as we evaluate and the pilots roll out, there's a scalability. There's certainly willingness for me to advocate for increased funding, but it's not as simple as I would say as money. Thank you.
I recognize the honorable member for Clayton Park West.
Thank you, Ms. Chair. I'm a little bit confused because you're saying we've spent 65 million, we've increased it, but actually the budget has gone down. In 2021, our previous government, when the Liberals were there, the budget was at 336 million. We've actually gone down with your increase from 288 million last year to this year 306. We're still down by $30 million. So how do you explain that? We haven't increased it at all if you go back to 2021.
I recognize the honorable Minister for Addictions and Mental Health.
Thank you, Ms. Chair. So if you look back to 21-22, so there was a budget of $247,983 for the Office of Addictions and Mental Health. There's also $94,591, which included physician services and pharmacology, so be your medications and physician services, so your psychiatrists, your medications, right, so your psychiatric medications, which gave a total of $342,574. So fast forward to 23-24, so the Office of Addictions and Mental Health is $306,855, plus $100,944, which is a total of $407,799. So it's increased, yeah.
I recognize the honourable member for Clayton Park West.
Thank you. So you've taken a part of the 336 included 100 million of something else. Is that, am I understanding it correct? That is no longer part of your office budget?
I recognize the honourable minister for Addictions and Mental Health.
So the way you presented the data from 21-22 and the way I'm presenting the data is the same. So there's been a significant increase to 23-24. I don't know how else to say that. Thank you.
I recognize the honourable member for Clayton Park West.
My next question, the Canadian Mental Health Organization of Nova Scotia issued 12 recommendations to the government on how they feel the money could be best spent, specifically when sufficient funding is given to community-based programs. Can the minister tell us how many organizations received increases in this year's budget and what percentage of increase?
You have, you're done at 5:07, so 27 minutes. I recognize the honourable minister for Addictions and Mental Health.
Yeah, so thanks for the question. So right now we're just in the midst of completing an evaluation of funding approaches for CBOs across the province. I'm sure as MLAs, we've heard from many groups, right, who spend more time writing grant proposals than they do actually helping people, right? So the Canadian Mental Health Association specifically, so we've done had a good announcement in the Truro, Colchester, East Hants region lately, met with their executive director. So they're going to be, actually it's a kind of a pilot project within that CMHA branch. And so some of the issues that they identified during our visit range from eating disorders to employability skills and these sorts of things. So the CMHA branch in Halifax also received funding from us recently for, I think, an innovative project, which is going to be geared towards seniors. So yeah, this would be for vulnerable adults living with, could be mental illness or could just be loneliness. So working with Karen Nichols here in HRM, so certainly some significant partnerships with CMHA, and so most of these partnerships are the first time that any of these groups have received funding of any kind from any government, right? So if you look at the bereaved families of Cape Breton, so outside of palliative care in the hospital setting, essentially there's no resources for families that lose a loved one. So that's another, I think, a great example of a community-based organization that's kind of doing great work. So a lot of these groups, they're not just increases, they're the first time they've received funding from anyone. So I think that's a good thing.
I recognize the honourable member for Clayton Park West.
That's wonderful, and if I may, this is my second list if I'd love to have. I'm writing them down, and if we can have them, I actually did the same thing last year with CCTH, and I'm yet to get those lists. So I'm going to ask within 24 hours if I can have them. So we asked in last estimate last year, and we're still waiting for those lists. So if we can have them within 24 hours, the way otherwise we never got them back. So please, I would really appreciate those. So just the names of the organization and how much money they got. So that was for that question. Then my next question will be, A key commitment by the Houston government was to create universal access to mental health by creating a new billing code that would allow mental health professionals like therapists and social workers to be able to serve anyone who seeks the service regardless of their socioeconomic circumstances. Can the minister tell us where are we with this billing code? The billing code is very important for this big promise by the Houston government. So where are we and when will we see that billing code?
I recognize the Honorable Minister for Addictions and Mental Health.
So yeah, so I think when you look at the budget, you look at the two pilots that are coming with the Dalhousie Clinical Psychology Training Program and the subcontracts with private clinical psychologists. That's two good examples of where that work is going to be undertaken. So in my mandate letter, there was 3 disciplines mentioned specifically. The psychologists were the first one. So that's what we'll be laying the groundwork. In the primary care sector, typically if physicians, it's a term called shadow billing. So you keep records of every patient that you see and these sorts of things, right? So this is something we'll be doing with these 2 pilots, and we'll certainly have a thorough evaluation in place with that. Yeah, and also, so for the subcontractor specifically with the clinical psychologist pilot, so this will be testing the private public service kind of integration, right, for the first time. So this will look at from health and human resource recruitment, compensation, right, for the private psychologists, and a big focus on making sure whatever we're doing is increasing access to service for Nova Scotians, right? So these will increase provision, for example, of diagnostic assessments. So for testing for autism spectrum disorder, ADHD, if there's equity-seeking groups who aren't getting adequate access to care and don't have private health insurance, right? So this would be a free service. It's something I've said right from the start. So I think these would be some of the comments that I would make with that. With the Dalhousie clinical training program pilot, so this will be in partnership with the faculty there, focusing on community-based practicing clinical psychologists. So you essentially have licensed clinical psychologists who would supervise senior students, right, in the clinical psychology program, actually providing services to people attending their clinic, right? So this could be, I think, also a good example of how that work will be started. Thank you.
I recognize the Honorable Member for Clayton Park West.
Thank you, Mr. Chair. That didn't answer the question of billing code. Those are all pilots that you're trying to figure out how much money it will require or what kind of services so that you can arrange a billing code. But it's almost 2 years, and we still don't have this billing code, a promise that was made, and it was in your campaign. When will we see the billing code through MSI? That was the question.
Yeah. So she said till 5:07.
I recognize the Honorable Minister for Addictions and Mental Health.
So yeah, so I would say that we're testing new models of care, right? And it's very important we increase access to service, but it's also important that we properly evaluate, right, these services, because it's the first time it's been done in Canada. It's certainly a very complex issue. I wish it was as simplistic as kind of developing a billing code, one billing code, right? But it could be potentially multiple billing codes. And as we continue this work, it will be with other healthcare disciplines as well, right? So we will be doing a thorough evaluation to look at the billing code specifically. But in the meantime, we have implemented a variety of new services, right? So your recovery support centers, your acute mental health day hospitals, Tranquility. So these are services right across the continuum of care. And we've always had our acute hospital-based system as well, right, for people that need help. So there's help available. This is a new expansion of a new program, right? So thank you.
I recognize the member for Clayton Park West.
Thank you, Madam Chair. So is there a way that you can give me some timelines? Is the intention still to have billing codes, or are we finding different ways that we're going to offer services without it going through MSI? And when will we see billing codes if we're still going to do that? Yes or no? Is the billing code still on the table, or have we found different ways we're going to do things?
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, the billing codes are certainly still on the table for sure. So like, I'm very aggressive with my timelines as well, like for sure. So we would expect to have those sorts of specifics by this summer. Would be my answer. Yeah, thank you.
I recognize the Honourable Member for Clayton Park West.
Thank you, Madam Chair, and thank you to the Minister. I'll be looking forward to that, the billing codes, this summer. Thank you. All right, the next question is, the PC platform estimates the cost of a new system to offer universal mental health care $100 million per year. Can the Minister tell us where that money is allocated in this budget, and if that $100 million will be added to the mental health budget?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Madam Chair. So I would say that there's been a significant increase in the budget this year, right? So $38 million. Certainly as these pilots, we undergo a thorough evaluation and scalability. I would have a very aggressive timeline on expanding of services for sure. So I think as we kind of, evaluate these programs and talk to Nova Scotians and talk to clinicians to see what's working better than the other pilots, there would be an expectation there will be an increased investment. I wouldn't venture to give a specific figure here today, but there will be an increased investment, yes.
I recognize the Honourable Member for Clayton Park West.
So in this year, it's not in the budget for this year or next year, or in 2023-24, that we will not see universal, because you would have to budget for it in order to have it. But I'm going to leave that question as it is, because I'm hoping to hear something in the summer, but I don't know where the money is coming from if it's not budgeted for the $100 million universal. It'll be for the following year, maybe, that's why. I'm just going to leave that with just the comments. The next question is, the current government promised a dedicated 3-digit telephone number for mental health crisis line. Can the Minister tell us when that will be happening, and will those costs be allocated to the addiction and mental health budget? How much will the federal government be contributing as well?
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, so the 988 3-digit crisis line was something I was supportive of in opposition, continue to be supportive of as the Minister for sure. We've had multiple conversations with Kids Help Phone and different stakeholders, so I was very glad to see the federal government also come on board with the initiative. We're working very closely with them with implementation. I don't have the cost figures here in front of me today, but I believe next fall is the targeted kind of implementation date. But once I do have the financial specifics, I would certainly follow up with the member. Thank you.
I recognize the Honourable Member for Clayton Park West with a reminder that the time changes at 5:07.
Thank you. Thank you, Madam Chair. And perfect. I'm very happy that this is still coming. But don't they have in other jurisdictions, so we know approximately the cost? We must have an approximate cost for this, and how much money. Is it in the budget? And other jurisdictions have this number. So what is the cost in other jurisdictions, and what is the amount that the feds have said they would give you, will be contributing?
I recognize the Honourable Minister for Addictions and Mental Health.
Yes, so I know the federal government had a significant contribution towards mental health in their campaign. I didn't get a chance to read the federal budget, I think, today, that was tabled today. I've had several very productive conversations with Minister Bennett, for sure. I think there's a lot of common ground there. But I would say the CRTC is sort of spearheading this implementation. I know a number of years back, they implemented a 3-digit crisis in the United States. They had a significant increase in call volume. So there's no cost given by the federal government yet, but we have to scale it up accordingly, right? So we'll see what happens with the uptake. Thank you.
I recognize the honourable member for Clayton Park West.
Thank you. So can you just give me a rough figure that what is cost? It's in Ontario, I believe, in other provinces. Can you give us a cost in other jurisdictions so that we know how much this should be budgeted for?
I recognize the honourable minister for Addictions and Mental Health.
Yeah, so from our perspective, we already have a provincial crisis line in place now. It's a 10-digit number, but there's highly trained, I would say, clinical staff that would answer those phone calls, right, for crisis situations for sure. So we do have the clinical pieces in place in many ways already. Whether we have to scale it up depending on uptake of the service would be probably a question we'll have to wait to see. But the CRTC would be certainly be responsible for any kind of infrastructure, I would say, physical infrastructure, telecommunications infrastructure, once the service is rolled out.
I recognize the honourable member for Clayton Park West.
Thank you very much, Madam Chair. Mr. Houston, when delivering the platform on addiction and mental health, stated that he didn't want any Nova Scotian without coverage to do without mental health access. In fact, he stated, I won't allow them to do without it under my leadership or under our government. Can the minister tell us what talks have been undertaken with the College of Therapists about covering their services under MSI to reduce the wait times for access?
I recognize the honourable minister for Addictions and Mental Health.
So I would say certainly everything we've done up to this point is about increasing access, right, to free high quality care for people, right? So really kind of identifying the gaps and getting rid of the gaps as quickly as we can. I think the integrated youth services expansion over the next number of years is probably a good example of that, right? So this will be across the province for youth. So that's a good example of I think an innovative expansion of services. I'm not sure if you're referring to registered counseling therapists, but they were part of our stakeholder conversations that have already taken place. I know the RCT specifically have been in dialogue with the office. I know we probably have a list of practitioners, but I know it's quite extensive, the dialogue. There's been a heavy focus on psychologists, social workers, RCTs, occupational therapists, and many others. So there's certainly some very active dialogue on that.
I recognize the honourable member for Clayton Park West.
Thank you, Madam Chair. So we are going to have those therapists under MSI, correct? That's the intention? The talk, you're going through the talks. Is this the ultimate goal, the intention that all the therapists will be billing through MSI?
I recognize the honourable minister for Addictions and Mental Health.
So yeah, as you mentioned previously, we'll be testing this through pilots, right? So the psychologists will be the first group. I know we've had some good conversations with social workers and registered counseling therapists, occupational therapists. There's even some primary care providers that actually oftentimes can be the first point of contact for mental health concerns in their own office, right? So those conversations are certainly ongoing, but I couldn't commit to that specifically today, for sure.
I recognize the honourable member for Clayton Park West.
Okay, so I have a good question here, I hope. If we have virtual mental health care services, why do we need the one-on-one hour session that has been offered? Anyway.
I recognize the honourable minister for Addictions and Mental Health.
Yeah, so Access Wellness, I've done a lot of interviews for sure. So I think this is filling a gap in care that didn't exist previously, right? So this is meant for your mild to moderate people, that there's services embedded in their community that they can just walk in, right? So there's also availability for telephone and virtual health options with the Access Wellness service. Highly trained, clinical therapists, social workers with advanced degrees, registered counseling therapists. There's 11 therapists that are working at these 4 sites. They're all from Nova Scotia. Very, very high quality of care. If there's, if someone come into an Access Wellness service, for example, and their needs were too acute or too complex, there's an opportunity to connect them to the formal mental health care system, right? Nova Scotia Health program, right? So it's not a linear process, right? So like you could access care a variety of different ways. So I often try to explain to my own constituents that there's no wrong door, right, when you're looking to access mental health services. And this service also, you can go back more than once. The idea is you don't have a record of your assessment or your visit, but you are given a plan of care as you exit the appointment. And this is just one of the new services in addition to everything else that we've been doing.
I recognize the honourable member for Clayton Park West.
I'm sorry, I'm even more confused now. So those social workers, you're going to put them in different parts of Nova Scotia, in communities, and you're giving them salaries or contracts for, is there a number of hours and dates? When is this being offered? And what does 1 hour do for anybody? You and I know what mental health. It takes 5 or 6 sessions before there's a proper relationship with your mental health service before they can even start treatment. A 1 hour, it blew my mind. How can that be useful to anybody?
I recognize the Honourable Minister for Addictions and Mental Health.
So yeah, I could speak maybe to give an example of the service in Sydney, right? So the Access Wellness Service we announced, I think, February 22nd, I believe, right, in Sydney. So I used to work with one of the clinicians there who was a clinical therapist, social worker. So does the one session benefit everybody that needs help? Maybe not. That's a fair assessment. Could it benefit people that needed one-time help? I think it could, actually. And this is not for acute mental health issues, right? These are for mild to moderate, right? So if you have a domestic issue, if you're having some substance use issues, and this is an opportunity to connect Nova Scotians with the formal system, right? So if you had, we're in Glasgow and you went to the Access Wellness, and you're having some substance use issues, you could be connected with Recovery Support Center, which we also just opened in Glasgow, right? So it's a connectivity point for people for help in their community. So the 4 sites are embedded within communities, right? So I think that's also important. You don't need a referral from a primary healthcare provider as well, right? So oftentimes that can delay people in getting, whether it's a consult from their family doctor to a psychiatrist or to a psychologist, right? So it cuts down on that bottleneck. But it's definitely meant for a specific target population, as is many other services that we already provide. So I would be hesitant to be too negative on a new service that is providing help to people that they haven't had before. Is this the silver bullet for every single person? Absolutely not. Is it a beneficial service for some people? I think it is. Thank you.
I recognize the Honourable Member for Clayton Park West.
I'm still having a really hard time understanding. So people will have to know which category. Are you going to put a list? If you have this issue with your mental health, you can go in, but if you have this, you can't go in, right? For these services. If you have serious issues and you get 1 hour and then you're waiting for 3 to 6 months, if you're lucky, what happens to that information from that 1 hour? Where is that information going? And would they they're meeting somebody new, so all that information has to be repeated. It's not the same person. It's a total waste of time for probably 80% of the people who actually need mental health. So how can you triage who can go in and who can't? Can you triage who has just simple, who needs to talk? I'm feeling down today, I need a chat. That's what you're providing the service for. Because if you have any serious issues, you should be connected right away and not be waiting 100. And that first contact, it takes a huge effort for somebody to open up, to even give. Mental health is, you understand how difficult that is. So you're giving an hour for somebody and then wait, and that information is lost somewhere. Where is that information going to be if they're even connected 100 days later or something is serious? How are we going to connect that connectivity that you're talking about? Sorry, I'm quite... That money could have been used by hiring more people so that instead of 100 days, maybe we can have it at 50 days.
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Madam Chair. So I would say there's no wrong door, right? If people aren't sure if they have to use the service, they should use the service. That's what that's what it's there for. I made sure before the service was launched that there's a mechanism in place for what we call the warm handover or warm transition in the healthcare system to the more formal service, right? So whether that's Nova Scotia Health, whether that's intake, whether that's, there's a variety of formal services within the healthcare system. I don't think I would probably agree that 80% of the people that go there wouldn't need it or wouldn't benefit from it. I'd be hesitant to make those sorts of claims. So I think we always evaluate any kind of new program, right? There's an expectation that it has outcomes that are helping people, and that's our number one objective. But I think if you look at, Tranquility is another example, right? So, we had over 950 people right now across the province using that service last time I checked. So I mean, that's almost 1,000 people that are getting help that they probably weren't getting as before, to be honest, right? So I know this certainly isn't for everybody. And something else I've seen, certainly in my time working in the healthcare system, is that sometimes people actually won't go to the hospital for mental health help. It can be quite stigmatizing, right? So if you're in Charlotte Street in Sydney, maybe we'll walk by, maybe you'll just walk in, right? Because I've known people that have done that, right? As opposed to going to the hospital or going to your family doctor, right? So, and if you miss that opportunity to get someone to just get the help that they need at that point in time, you might miss that window, right? Because that does happen too. So certainly hear the concerns, but I think there's certainly some benefit to this though as well.
I recognize the Honourable Member for Clayton Park West with a reminder there's 3.5 minutes left.
Exactly. Thank you. So I'm going to end it with this. I'm going to spend my time on this question. So I just want to clarify. So they go see somebody, and that information is going to be collected by who and given to the, let's say, they need at least a psychologist or an assessment, or they may need a psychiatrist because they need medication. That information, that serious information, who will be keeping it? Who is in charge of getting it to the next person they're going to see? Is that mechanism there?
I recognize the Honourable Minister for Addictions and Mental Health.
So at the conclusion of an appointment, the patient would be given called the care plan, right? So the patient would take the care plan with them. I mean, the individual clinicians who work at these sites would be no different from, a social worker in the hospital, where they would have to adhere to their standards of practice, right, with their regulatory body. So it'd be the confidentiality and patient, all the stuff would still apply based on the professional standards. But the patient would be given a plan of care, then ultimately it would be up to the patient what they want to do with their personal health information. But otherwise, the clinicians would still have a responsibility to adhere to their standards of practice.
I recognize the Honourable Member for Clayton Park West.
And what have you put in, when are you going to evaluate this service? When does it start? When does it end? And what evaluation is put in place for it?
I recognize the Honourable Minister for Addictions and Mental Health.
Yes, I requested an update from that this morning. So we had 168 calls so far. So a little over a month, the service has been launched, but 68% of the calls are from those who identify as female. So typically any program is a quarterly evaluation for sure. Sometimes I ask for them more often than that. So I mean, based on the call volume and certainly what we hear from the people utilizing the service will have a significant impact. And if there's, we'll continue to look at that for sure.
I recognize the honourable member for Clayton Park West.
Okay, so I'm hearing calls, so this is not face-to-face. The 168, they've all been calls, correct? Has anybody had face-to-face?
I recognize the honourable minister for Addictions and Mental Health.
So there'll be a combination of contacts. It could be calls, it could be in person, it could be both. Yeah.
I recognize the honourable member for Clayton Park West.
Could the minister provide us with how many in person and how many calls and which areas in this province who are receiving this service? If we could have that information so far. You only have 1 month, but just to see. And I thank you very, very much. I'm sure.
Order. The time has now lapsed, and it is the NDP's turn. I recognize the honourable member for Halifax Citadel, Sable Island.
Thank you, Madam Chair. And thank you to my colleague for kicking off the discussion. And what I might do is I actually might just sort of ask a follow-up question on that service. So what are the outcomes being monitored for that service?
I recognize the honourable minister for Addictions and Mental Health.
Yeah, certainly there's a variety of outcomes. I think when you look at any of these new services, right, whether it's the mental health acute day hospital, for an example, we were able to collect data on the impact that had on provincial bed inpatient occupancy rates. So I think if you look at that, just one example, but I think there's a variety of factors that could be looked at as outcomes. So this would, if it decreases visits to the emergency department for psychiatric presentation, would be certainly an outcome that I would be probably interested in seeing. I know there's also, I think it's also very important to speak to the people that are using the service, right? So we certainly had, significant focus with that as well. But I think if you look at any of these new services, the increased access to the system, which in effect takes pressure off the formal system, right? So in complementary to that.
I recognize the honourable member for Halifax Citadel, Sable Island.
So I was going to ask you about the acute day hospitals and about that decrease that you're seeing. But I mean, that's sort of at the output level. So I guess I'm wondering at sort of, the questions I'm wondering about are sort of the functioning level, like the actual mental health outcomes.
Your mic went off. I recognize the honourable member for Halifax Citadel, Sable Island.
Sorry, I was just waiting for the chatter at the table to quiet down so I could hear myself think. So I'm interested in actual sort of the mental health outcomes. So the acute day hospitals is a question that I have, but continue to focus on the telehealth program, the TELUS Health program. I mean, you talked about, decreasing ER rates, which is, I think really important, but that surely would only be sort of correlation, not causation. You could never attribute a decrease in ER visits aside from someone's opinion, like would you have sought, access at the ER if you couldn't have accessed this? And I was actually quite surprised to see when I went back looking at the wait times data that there had been an increase in wait times, certainly for non-urgent care most jurisdictions, and I won't walk through them, but that was sort of what I was seeing. So I guess I'm wondering, with the TELUS Health program, what are the mental health outcomes that you're measuring? Not outputs, not numbers like bums and seats, but what are you actually hoping improves, and how are you measuring that?
I recognize the Honourable Minister for Addictions and Mental Health.
So yeah, I would say as a part of the outcomes monitoring, I think you need to look at the treatment goals if they're being met, both from the client and the clinician perspective. Is the client progressing during therapy? I mean, it's difficult to ascertain that. You have to talk to the client and talk to the clinician, right? So this is typically conducted from the patient's perspective, whether it's every session or every 5 sessions, it's at a regular interval. There needs to be feedback given to us as well from both the client and the provider, the clinician of the care, just to see how things are going, right? Is it doing what it's actually intended to do? Oftentimes, I've seen the clients, they do have an increased awareness of their own progress if they're starting to feel better, right? Which is often an indication that it's successful. So I think the clients and therapists, together review, has their decision-making process improved? Has their quality of life improved? Is it reliable data that we're seeing? Is it valid? So I mean, it's going to be quite complex, right, to get a very accurate understanding, I would say, of an individual's mental health. But we certainly have outcomes measuring in place. So I think the client voice is certainly something that I focus a lot on to understand their perspective in the whatever the program may be. And the clients are able to complete assessments wherever they're at. So I think that is helpful. So just as a general practice, I would say that the routine outcome monitoring within the office itself focuses on routine outcomes measurement, increased client improvement, like they're feeling better. And yeah, thank you.
I recognize the Honourable Member for Halifax Citadel Sable Island.
And so maybe we can go back to the acute day hospitals. I know that the intent was to gather quite a bit of data, especially from the first pilot. And so I'm wondering what the outcomes that were being measured there were, and if you can share the results of that.
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, so we talked about the mental health acute day hospital before, sorts of address the gap in the current system for intensive treatment, which doesn't require an overnight stay in hospital, which I think is a good thing for people that are stable enough to go back home. So certainly as very positive feedback. I was visiting the one here in Halifax. Clinicians and patients are very, I would say, happy with the service. There was a young psychiatrist who just decided to be there. It was his full-time job now is there, so he was very happy with that, which I think it's also kind of being used as a recruitment tool as well. So I think in terms of actual, I guess, data, so there was 87 individuals who have been discharged so far. So 92 would be acute sort of cases. The average length of stay is somewhere between 14 and 26 days. Typically an acute inpatient psych unit's a bit up to a week is kind of what I used to see. So that's about over 2,847 inpatient days that would be saved within the formal healthcare system. So that's about 6% of all inpatient acute psychiatric patient days provincially, and 13% of Central Zone's acute psych patient days capacity. So I think that's quite remarkable statistics for sure for an inpatient acute system. I don't think at this point we would be able to say that those same numbers will translate to Cape Breton or to the other two health zones, because they're different parts of the province, different concerns. But I would say that the preliminary data on the day hospitals has certainly been very positive. And it really looks at having the patient heavily involved in their own care as well. So they kind of can report to us on their own progress, and then it's more of a collaborative relationship with the clinician. I'd say just generally speaking, it's a much different field than the acute inpatient sort of setting, which I think might be a good thing sometimes, you know. So I would say that it's very positive.
I recognize the honourable member for Halifax Citadel Sable Island.
And so what are people saying in terms of positive feedback? What are the aspects from a clinician and from a patient's point of view that are positive? And have there been any concerns expressed about the model from either clinicians or patients? And is that being collected in a formal way?
I recognize the Minister for Addictions and Mental Health.
Yes, when I made the announcement in Cape Breton, one of the speakers was a young guy from Cape Breton who's had some experience with substance use in the formal mental health care system. He's probably one of the more impactful speakers that I've had at an announcement myself, for sure. He spoke from the heart, for certain. So I think he gave a very balanced perspective of why it's a very good thing. I think Dr. Sreedharhan here in the Central Zone was sort of the lead clinician to kind of get this first day hospital stood up. So she would have extensive expertise from the UK. She's a very smart person. So she's also works closely with the Al-Hil, as you know, to collect data and outcomes at least every 3 months, for sure. She was actually earlier than that for the first pilot. So I think you just rely a lot on, you know, clinicians with expertise in the area. Just talking to patients, it's like the day I was there, they were just very happy with the service. They get to go home to see their kids or their wife, or, you know, it's just a good, you know. And there's also a way to transition to whether it's day programming, whether it's back to, if you deteriorate, you might have to go back to an inpatient admission. Hopefully not, but sometimes that does happen, right? So I'd say the both formal and informal indications have been pretty positive.
I recognize the honourable member for Halifax Citadel Sable Island.
Even I can forget. So. That's perfect. And so have there been any concerns expressed with the day hospital model in terms of barriers, so maybe related to transportation or other barriers, and how has the program supported folks?
I recognize the honourable Minister for Addictions and Mental Health.
Yeah, I would say transportation's not so much of an issue in Central Zone, but I know at the Aberdeen hospital, we went to the Recovery Support Centre there, and where they have a more rural target population, transportation certainly is an issue. Some people miss appointments because they can't get a drive, right? Sometimes it happens. I know when I worked in the hospital system, we had, you know, taxi chits or transit tickets for people, and typically that could be the difference of getting to the appointment or not sometimes, is, you know. I certainly think transportation is a significant issue in rural, I would say, parts of the province. We haven't heard that much specifically with the Central Zone pilot, I don't think. I think you see, like, the Recovery Support Centre, even in Dartmouth, right? They're usually we try to put things along transit routes and, you know, highly accessible locations if we can. Well, if you're in Yarmouth or Northern Cape Breton, you have to have a different way of thinking, right? Because it's not going to be feasible. But I wouldn't say transportation is an issue with this location, but it's certainly an issue in rural parts of the province.
I recognize the honourable member for Halifax Citadel Sable Island.
I'm going to wrap up a follow-up question and then go ask a couple of different questions. So would the programs in rural areas or the acute day hospitals that are set up that are serving more rural populations, will, you know, offering taxi chits or figuring out transportation be part of the services? And then I'm wondering what the psychiatric inpatient occupancy rates have been throughout the province, and also if you know, or if ER presentations for mental health, what's the trend in the province?
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, I think initially, I don't want to say post-COVID, but when things were, really locked down, I think the presentations to ER were up around somewhere 34%. I think that has leveled off slightly to, I think we talked about this morning. I could get the specific number. I don't want to say a specific number and be wrong, so we can follow up. But I think it's in the 20s. Like, it's still higher than it was pre-pandemic, for sure. I think if you look at the rural parts of the province, we have seen pretty good success with virtual psychiatric care in ERs, right? So St. Martha's was one of the kind of pilot locations, and there'll be expansions with that service to the South Shore, for example. So it's not always appropriate in the ER setting, but sometimes it can be whether you need a psychiatric medication adjusted, or there's times where I think it can certainly be valuable. I think the active transit issue specifically is something that's probably been lacking, especially certainly in Cape Breton, in other rural parts of the province. So I know that giving decisions to people that are providing the services is probably the most efficient way to do that, right? Whether it's taxi chits or these sorts of things. But having an active transit is certainly a conversation that I have with my colleagues, because it's certainly an issue that I hear. Yeah, that's all I'll leave it at that. Thanks.
I recognize the Honourable Member for Halifax Citadel, Sable Island.
And I'm wondering if you have access to data from the Maple Public Virtual Services, and what percentage of those calls or text exchange are for mental health issues.
I recognize the Honourable Minister for Addictions and Mental Health.
I wouldn't have that because it's primary care. It's mental health oftentimes, but I thought that'd be more appropriate for Minister of Health and Wellness. Yeah.
I recognize the Honourable Member for Halifax Citadel, Sable Island.
I wanted to turn to talking about integrated youth services. So, I mean, as you know, this has been an area of my work and focus for some time, and my studies as well. So I've been engaged, nationally with different initiatives, as well as internationally. And, I think I am glad to see the words integrated youth services uttered in Nova Scotia. I was I think we were the last jurisdiction in Canada to really talk about it. So also really, interested in seeing that initiative develop. In the discussions around the budget, so when I saw when I got the breakdown of the 17.7 million and that there was almost 2 million for IYS, I guess I was wondering, like, realistically what's planned for this year, and I was a bit concerned by the information provided actually on budget day, so hoping you can elaborate a bit. I was concerned about the reference to folks being young people being referred into integrated youth service and through other IWK services, and I guess there's a pretty well researched and established IYS model that exists. I mean, the federal government has just provided millions of dollars more funding for IYS Net after funding Access Open Minds Network. So I mean, there's a fairly good understanding of what the IYS model looks like, and one of the key tenets is actually removing the need for a gatekeeper or any kind of referral, right? So the idea is like, you were saying no wrong door, but the idea is that a young person either through online or in person can walk in and access a service when they need it. So I'm just wondering if you can talk a bit about what this is looking like in terms of the model in Nova Scotia, and also provide an update on negotiations between the IWK and Nova Scotia Health to ensure that we're actually implementing youth services that go, sort of 12 to 25-year-olds, so that sort of bridge the traditional child to adult transition at 18.
I recognize the Honorable Minister for Addictions and Mental Health.
Yeah, so I certainly agree that the integrated youth services, should be very low barrier to access, right? So I spent some time in Escazone. It was one of my first meetings that I had after being in this position. So I think the integrated youth service model in Escazone is much different than the IWK, right, for example. So I think, kids would come there to go fishing, to have lunch or something, right? Then they might happen to talk to a clinician. It wasn't a formal, system, which I think is probably a really good thing, right? So I think the whole thought process is really just, you can drop in, right? Especially for youth, or for their caregivers, or for elders in the community. So we're really focused a lot on wraparound supports, navigation, outreach. So I think when you look at the 12 to 25, I think I've seen that myself as the clinician. You get that age out, so to speak, age, right? You're 18 to 19, where people kind of have a difficult transition in time. So I know there's certainly been very active conversations with the Nova Scotia Health and IWK with that specifically. So I think there would be an expectation that we try to do this as evidence-based, but as quickly as possible. I think one of the challenges we face, not just in Nova Scotia, but across the country, is the human resource aspect, right? So we have to be very innovative in our strategies to properly, to staff these centers. But I know that the department is certainly heavily involved in that work. But I do think ultimately the community, right, is that the community has to buy into the service in order for it to certainly to be effective. There's certainly a role for community services, I think, right, education, in terms of the curriculum that we're developing, and justice, right. This is across governmental initiative, I would say. The service specifically in Escazone, it has primary health care, it has dental care, it has activities, right, these sorts of things. So the goal in the next 4 years would be to have them in all 4 health zones. So I think once we can get these models effectively implemented, there would certainly be an expectation that I would have to get them across the province as quickly as possible to help kids, right? So I know I've had a number of conversations with my federal counterpart. Certainly think there's some common ground there. So I'll certainly see what was in the federal budget today. I haven't had a chance to see it yet, but I know they had some significant commitments to mental health in their election as well. So I think there's certainly a collaborative partnership there. So I'm hoping that we can expand that sooner than later.
I recognize the Honourable Member for Halifax Citadel Sable Island.
Thank you. And definitely, Escazone as part of the Access Open Minds Network provides a really important model. And, part of Access Open Minds was the intent to, how do you have standards based on evidence that then become culturally and contextualized, right? And so how do you do that in communities? And I think Escazone is a great example of how that worked. In other jurisdictions, the Access Open Minds Network, which was early, but also thinking of the BC Foundry System and the Ontario Youth Wellness Hubs. In that case, when the province committed to integrated youth services, there was actually a significant commitment to rolling out. So in fact, communities were invited to basically prepare themselves. And it wasn't just about government, it was about community-based organizations and other institutions. And communities had to come forward with kind of like a plan. So they had to kind of prove that they were ready to take on an integrated youth service. But in BC, actually I'd have to go back and double check the numbers because they're dropping off my head, but basically well over a dozen within 3 to 4 years. And Ontario Wellness Hubs, quite similarly, asking communities to come forward and have done 2 rounds of funding to expand the funding of integrated youth services. And I'm just wondering why the government of Nova Scotia hasn't chosen to go that route when it seems to be, I also think of Kickstand in Alberta. There's an expansion in Manitoba happening. Kind of why haven't we done this in Nova Scotia?
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, so I think the IWK example just has been kind of in the process of being set up right over the last year. Certainly the focus on youth mental health, that was certainly something I focused on a lot, especially with the non-urgent wait times, you know, what they are. It's certainly a focus of mine. So I think there's a real focus of mine for sure, the expectation that once we deem that these are effective services for youth, we would be scaling them up as quickly as we can. I think there's a lot of uniqueness in different communities as well, right? So I think, you know, it's especially with communities that don't really trust the formal healthcare system, right? Like in Escazone, for example. So I think we need those community kind of partners, right? That, you know, some will probably come forward with proposals, some probably won't, right? So I think certainly an expectation that we kind of really keep a close eye on the shared outcomes. I know there's been frequent conversations too with leadership within the IWK, with both national and international kind of leaders in this space. So I think we are a part of the federation as well. So why it didn't happen sooner in the province, I'm not too sure, to be honest. But I think it's certainly a focus of ours, and we'll continue to focus on that.
I recognize the Honourable Member for Halifax Citadel Sable Island.
Yeah, and I mean, I guess, you know, like I said, I despaired at seeing the previous government never mention integrated services. I definitely see the commitment here, but I think we could still go faster. Like, I don't think there's a need to wait for the evidence, and I think these models that consider community complexity and uniqueness exist, and they've proven, you know, I think we have a lot of data from other jurisdictions in Canada that have proven, you know, how, you know, Foundry, for instance, has centers in really diverse communities. So I guess I would just, you know, really encourage rapid access. I think the evidence base is there, so we don't need to wait. You know, and another step in Newfoundland through Choices for Youth, which was sort of a lead partner, but working with funding through RBC, actually went out and actually in their rural and remote communities did all the, I think I gave you this report, but did all this research, right? Like, so we're like in really remote areas of Labrador, how does like a walk-in service work? Like, what does this look like? And what does the community need? And so, you know, and again, you know, it was completed pre-COVID. So, you know, I really think we're sort of playing catch up, and I'd love to see us catch up sooner. I wanted to ask as well, when the department was running through the $7.7 million in investments, there was $1.576 million for what was described to me over the phone as police pilots, which I was a little bit concerned about, because that's certainly sort of not what people are talking about. Madam Chair, I would ask that there be order.
I recognize the Honourable Member for Halifax Citadel Sable Island.
Thank you, Madam Chair. And I guess I would just encourage, this is the second time that I've been interrupted by the Minister of Agriculture in this setting, and I'm not pleased. So you know what? This is hard work on this side too. I'm tired and hungry too. And if you don't feel like being here, take a break. You're an adult. So I was wondering about what was called police pilots, because certainly, you know, across the country and around the world, there's been a lot of work in looking at sort of emergency response to mental health crisis. And actually, you know, the model, like the pilot in Toronto and Edmonton and, you know, elsewhere, is really about getting police out of there, or at least reducing the amount of police response and actually increasing greatly the amount of response by mental health professionals. So I guess I wonder if we can talk about what these are and what's really being looked at in Nova Scotia.
I recognize the Honourable Minister for Addictions and Mental Health.
So yeah, this would be mental health and addictions crisis response, the mobile crisis response. Something I've been trying to push since my nursing days. Certainly a great need for this probably across the province. So these would be these could be a variety of complementary clinical makeups, I guess. I was trying to sound too healthcare-ish there, but so it would be to improve outcomes for those experiencing crises for both people living in more urban centers as well as rural. So we did a thorough jurisdictional scan. You mentioned Alberta. There's some other jurisdictions that have done these sorts of initiatives. So this will have to be done very carefully, right? So, in conjunction with the provincial crisis line, which will be 988, not too far from the distant future. Increased training for first responders as well, with trauma-informed and culturally safe practice. So I worked with a community outreach team in Cape Breton. So this was a plainclothes police officer, and it'd be either a psychiatric nurse or a social worker. But the issue with them is they had like 9 to 5 hours, Monday to Friday. So like it was great for those hours, but it's not always mental health crisis can occur outside of those hours. So this will be looking at a variety of clinical compositions. I've seen sometimes people do a wellness check and there can be a weapon involved, and psychosis and things can kind of. There needs to be the police presence sometimes, and sometimes it makes it worse, right? So these will look at a variety of compositions of teams, kind of as we move forward. So I think we've had significant conversations with Justice and a number of police organizations and clinicians across the province. But again, it's scalability and human resource capacity, right? These sorts of things. So there's certainly significant demand. I believe there was a service to an HRM, right, for mobile crisis, but I don't believe that was 24/7. So if it's difficult, right? But that being said, I think if people could get it, this sort of option, it takes a lot of pressure off first responders as well, who are sometimes put in situations where they're not properly trained to handle the call, right? So I think I'm very excited for this kind of as it moves forward. So this is really about increasing the knowledge of mobile crisis response across the province, and really kind of, for the first time, having an integration with justice and the healthcare, right, sectors, because there hasn't been that traditionally in the province, and really training, helping our frontline responders to have the proper training to at least know when to divert to a clinician, right, or what have you. So we have had significant engagement to see where the desire is across the province. I know in Portapic is obviously a significant tragedy for our province, so we've hired a community liaison staff. I believe it was just hired. Were they hired? Yeah, just recently hired. So to go into the fire department, go into the Legion, not your traditional like sit in my office, come see me for an appointment sort of setup. Because when we kind of oftentimes when it's up formal services, people won't use the service because they stigmatizing or they just don't use it, right? So I think this is a very needed service. It just has to be very careful that it's rolled out safely. So it could really create an alternative response to mental health crisis, right? Essentially, so we'll certainly keep working on that. I certainly think there's some potential here to help people in the service.
I recognize the Honourable Member for Halifax Citadel Sable Island.
And so in this year, the 1.5 million that's committed, what will that be used for?
I recognize the Honourable Minister for Addictions and Mental Health.
So the primary cost would be the healthcare human resource capacity for these teams, right? So it could be registered nurses, social workers, it could be a program, sort of policy folks. So it'll be kind of through the healthcare sort of budget, right? So obviously this is contingent on human resource capacity, but sometimes, you know, you might have a social worker that works, you know, 60% of their shifts in a day program. They could do 40%. Right? There's ways you could be, I think, innovative to staff it up a bit quicker. But that's primarily for the healthcare clinical staffing aspect of it.
I recognize the honourable member for Halifax Citadel Sable Island.
And so I'm wondering if you can clarify how many FTEs are foreseen within that 1.5 million. And then I'm just going to like switch us forward a little bit. But on health human resources, so obviously a huge challenge everywhere. And so I'm wondering if you could talk a bit about like what's the vacancy rate across zones, and what are you seeing as the very specific challenges to filling those vacancies for addictions and mental health in Nova Scotia?
I recognize the Honourable Minister for Addictions and Mental Health.
So we've had, I think, pretty good success lately. Speaking to psychiatry to start off, I guess. So I just found out this morning that the federal government instituted the home buyers ban. They didn't exempt healthcare workers coming to Nova Scotia, so we got that figured out last night. So, so I was very glad to see that happen, because we have a lot of people coming from the UK or where have you, right, to practice clinically. I certainly think our post-secondary institutions probably play a very important role, right? So if you look at, you know, Cape Breton University with the medical school and their Bachelor of Social Work. The Bachelor of Social Work isn't getting as much press, but I think it's a very important program for social workers. You look in the budget here with the graduate program in Dalhousie. I believe, how many seats is that?
It's expansion, 6 to 10.
Yes, that's 6 to 10, I think, seats with that with this program at Dal. So basically a clinical nurse specialist would have a high level of training for addictions and mental health care. I know we're in active conversations looking across other allied healthcare professionals, I would say. So there's certainly some ability to grow our own, but I do certainly think the immigration piece is significant. We've seen recently the ability for people in the United States that wouldn't have to come here to go through the red tape for medical practice. So that'll impact indirectly, you know, psychiatry and other sort of medical professions. So I do have some specific the vacancy rates.
Like how many we have.
So I guess across the province, we have 123 psychiatrists, 648 psychologists, over 550 social workers, over 370 counseling therapists, and 988 nurses. So these would be nurses that work within the formal, I guess, mental health and addictions system. So these would be individuals registered with their regulatory bodies, which is just online and accessible. So as of September 2022, the vacancy rate for all clinical positions is 24.9%, which is down from 27.4% from October 2021. Vacancies have gone up for counseling therapists, psychologists, and social workers. So for counseling therapists, so the most recent we have is 40%, psychologists is 36%, social workers is 22%. So in regards to clinical positions within the, I guess, the formal addictions and mental health care system, so you just want the vacant FTEs. For psychologists, that's 33.7. Social workers, 97. So that could range from clinical outreach workers, clinical program coordinators, patient access navigators. Clinical therapists, 70. Nurse practitioner, 5. Registered nurse, 121. And LPN, 32.
I recognize the honourable member for Halifax Citadel Sable Island.
Thank you. And I can go back and those numbers went by a little bit quickly, but perhaps that table could be shared, and obviously will also be in the transcript. So, what do you think? I mean, you talked a bit about some of the jurisdictional changes. Are there other key challenges that you see in recruiting health human resources that you're hearing about from folks that you're trying to get into positions?
The Honourable Minister of Addictions and Mental Health.
Yeah, like I've been to the 4 health zones, been to, I don't think every hospital, most of the hospitals across the province. The number one thing I hear about, honestly, constantly is retention, right? So I think that the challenges of attracting new staff are certainly, well established, but we have to keep the staff that we have. So I do think the retention announcement recently was certainly a very positive step, especially for nursing vacancies and other allied healthcare professionals. So I think retention is probably the biggest thing that I have heard from. And also I think it's been a tough time to work in healthcare the last couple of years, right? It's been a lot of burnout, a lot of stressful circumstance, right? So we're certainly working with Nova Scotia Health to increase mental health supports, not just for the patients, but for the staff, right? So, but I think certainly the retention is the biggest factor that I've heard about.
I recognize the Honourable Member for Halifax Citadel Sable Island.
Earlier in the discussion, you talked about, trying to establish a system where there's sort of no wrong door, right? Where you can, but, I think realistically in Nova Scotia, there's still lots of doors that aren't particularly open. So, if you call central referral for the IWK mental health, parents and families and children are often waiting quite long waits. And, and I guess, we hear a lot in our office from folks who cannot get the level of mental health care that seems to be what is needed or what might be effective for them. So there are folks who are maybe not connected to primary health care, or maybe are on a wait list for their sort of first intake appointment in counseling, but with Nova Scotia Health, but are actually kind of actively in crisis. So showing up in ERs, not being admitted, and really kind of existing in this space. And they don't seem to be being picked up by the acute day hospital. I know that I've reached out to Ken before and asked about these situations, and we've had them shared with us. And I've sat in the ER with a couple of families this year for very long periods of time, and late into the evening. And so I guess, my perception, honestly, is that there is a risky gap around folks who are in sort of high need and assess it not being needed to be admitted, which is good. But I guess I'm wondering if, I see the urgent numbers are quite good in terms of wait times. But I guess I'm wondering what your assessment is. My perception is it's a huge gap, and it's a dangerous gap. And I think, in my budget response, I shared 3 situations recently in HRM where, folks were in pretty deep crisis, where they had family around them who were able to reflect and report on that. And in 2 cases, the people sort of died as a result. Their family attributes it to their mental health status. So, yeah, so I guess I just would, I don't know how to ask a question about numbers, because obviously it's hard to count what doesn't happen and, that sort of thing. And if people aren't getting admitted and, it's hard to count folks in crisis. But I guess what would you say to that?
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, there's certainly challenges. I would say it's not urgent. I think the cases you're referring to are not quite crisis, but they're not quite not urgent, right? So I think that it's a delicate window, I would say. I think just across the country, I think demand is probably up. It certainly is up in Nova Scotia based on our data. I think it's similar in other provinces. Having been to hundreds of code whites in emergency departments, it's a very challenging space for mental health patients, right? So I know the IWK is doing some different work with the triage process itself with psychiatric patients. I know the new facility in Cape Breton, for example, that's being built has a different dedicated space for psychiatric assessments to that unit specifically. So I think it is important to say that we do, not perfect, but we do a good job at meeting our crisis targets for urgent mental health care, which I think that can't get lost. That's very important. I think too, something I do hear a lot about, there still seems to be a bit of a misconception that everyone that has a mental health issue needs to see a psychiatrist, right? So sometimes they do for sure, right? But sometimes they would benefit a lot more from more of a highly accessible community-based resource, right? Whether that's a peer support worker, whether that's going down to your CMHA branch and just having a coffee, right? Just to talk, right? So I think it's also important, we have, you know, a number of conversations with healthcare professionals to ensure that they're all working at the top of their scope of practice, right? So, because every scope, it's harder to find more people, right? So I think that's something we've had a pretty good dialogue with clinicians, right? So, and I think in terms of the expanding services like the mobile crisis service will hopefully help those people before they get to the ER would be my goal, right? So I think in the BIOS model we mentioned earlier, is another option for people, you know, ADHD or, you know, on the autism spectrum to get help at home, right? Sometimes those can be difficult situations at home, right? So, and sometimes they lead to hospital admissions where they're not really even in the right place, right? Sometimes the child or the patient, right? So I would say more work definitely needs to be done. I think a big issue that we've been discussing with clinicians is the medical clearance aspect for people in ER with mental health issues, right? So, because you do have to rule out a biological cause for the issue to make sure it's not physical before you can then get the crisis assessment or the mental health assessment, right? So we certainly have had conversations with clinicians to how to safely address that. That's a very delicate one because you can't miss something physically, right? So certainly gaps, but I certainly think, the emergency departments are difficult places for people with mental health issues, for sure. So it's certainly something we'll continue to work on, but I do think all these community-based resources should hopefully, won't help all, but should help a lot of these people that before they get there would be my hope anyways.
I recognize the honourable member for Halifax Citadel Sable Island.
Yeah, and I mean, certainly, you know, I mean, integrated youth services is definitely founded on that model that, you know, early intervention, that not everybody needs to see a psychiatrist, but, you know, but when there are wait times too on the non-urgent side, then those, you know, more, you know, transient mental health issues can become more embedded or become more severe. And then also you get into a cycle around the social, you know, the social determinants of health, right? So if your anxiety is preventing you from going to school, and then you miss a semester, and then it starts to really impact how you feel about yourself. And I mean, you know all this. So you talked about increased demand. So can you talk about what does it look like? What are the numbers like year over year in terms of numbers of people like on the wait list? And would you attribute the increasing wait times to absolute increases in numbers, or what else is going on?
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, I certainly don't feel like I would have a good answer for that question, right? So I think it's anecdotally, not saying this based on any data or anything, but I think, you know, there's a lot that's happened in the world the last couple of years, right? And you know, it's a tough time. We've certainly seen increases in presentation to emergency departments, increases to crisis lines, right? So there's certainly some impacts on people's mental health. We've also had significant population growth in the province, right? So the system's more pressure on the system, right? So I certainly wouldn't have one specific factor to that. Then you tack on inflation, everything else that's going on across the country. It's a tough time right now, right? So, but I certainly wouldn't have a good answer for that question, I don't think. Thank you.
I recognize the Honourable Member for Halifax Citadel Sable Island.
I asked in the House today about the NSPU grievance regarding the contract with TELUS Health, and I guess I'd like to invite you to talk about the department's response and position to that issue.
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, I certainly have a lot of respect for frontline clinicians, right? Whether they work in the public or private sector, for sure. So that service is a new service, you know, with Nova Scotia clinicians. So I know there was a number of questions about the procurement and why it was TELUS Health, right? So this would have went through the standard government procurement process, right? So outside of my control. So I look at it as a way to help take strain off those working in the public system as a complement, not as a competitive, right? So, I mean, we know the needs with non-urgent and the pressure on our hospital system, right? So, you know, I look at this as a partnership between the two, not as a competitive, you know, aspect. So, I mean, and oftentimes, you know, I've known clinicians who've worked in both the public and the private at the same time, right? So, and I don't see what's wrong with that as long as any Nova Scotian doesn't have to pay for the service, right? So.
I recognize the Honourable Member for Halifax Citadel Sable Island.
And with that program, and then with I forget how much it was, the piloting for private assessments that's happening this year. What are you seeing in terms of the compensation model? So what's the per hour cost in the public system versus the per hour cost happening in the private system?
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, I would say that specific question will be part of the evaluation of the pilots, right? Especially with the psychologists at DAL and the province-wide. So we'll certainly, we've been meeting with them now for quite some time, especially with the psychologists, for sure. I would say we have a very collaborative relationship. So as I mentioned earlier, I think in the summer we would have some more specifics to say in a compensation model. But there'd be an expectation that it's going to be available for people. So I wouldn't look at the cost as a deterrent, if that's worth anything. Thank you.
I recognize the Honourable Member for Halifax Citadel Sable Island.
Yeah, I mean, I think the cost, it's one portion of outcomes measurement, but I think building into the public system is really important. So, and if cost efficiency is part of what makes that a better investment, then that's an important thing to know. So I have a broad question about basically if you can share with us like the assessment criteria and the evaluation criteria for contracts with nonprofit organizations and community-based organizations. And then my specific example around that, so the pinwheel service that you were talking about through Autism Nova Scotia, I mean, it's certainly there's a huge need, no question. And I know they were oversubscribed by a lot. So, I mean, I'm happy to hear that they have 600,000, but you know what one-time funding does, right? So I know they can make good use of 600,000, but they could make probably better use of 600,000 if they knew that it was ongoing. Because essentially, if it's FTEs, then you're kind of asking an organization to staff up, but only with temporary people. So then retention becomes an issue. And that affects clinical relationships. I mean, all the that whole cycle. So I'm curious to understand what we're asking organizations and what we're requiring for evaluation, and then how can initiatives like Pinwheel get off of this one-year bump cycle?
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, so I see that there's a province-wide framework that we're developing. So that should be developed in 23-24. Hopefully before then is my goal. So I know Pinwheel, for an example, when I was there, the uptake of the service exceeded their expectation, right? Because they were actually servicing patients that didn't even have the needs that they were designed to service, right? So they were sort of, how do we navigate them to the formal healthcare system, these sorts of things. I mean, I would certainly looking forward to the, when the framework evaluation is complete, to get the core funding for all these groups, right? So, and being MLAs, we know there's often groups that can get a little bit of DCS, a little bit of health, a little bit of justice, right? So it's very confusing for the people that were running these organizations. So the idea would be to provide grants just directly to the CBOs on a consistent basis, basically. So there is a dedicated position that's going to be staffed in the spring too for a community liaison person within the office. We'll have direct contact with a lot of these CBOs across the province, because when I came into this position, we didn't really even have a good a list of the groups, to be honest. So that's one of the first questions I asked, right? So and some of them range from services for youth. I certainly think Autism Nova Scotia will continue to be a partner of certainly of my office for sure. And you look at someone like the Mental Health Foundation, right? They do a lot of great work across the province with grant distribution. But any kind of money, essentially from the department that's given to a CBO, would have accountability framework with it too. I wouldn't have that in front of me, but there would be specific criteria with the framework that we would check on for sure.
I recognize the honourable member for Halifax Citadel, Sable Island, with a reminder that there is only 6 minutes left.
Great, thank you. So would you be able to follow up and share that accountability framework? Obviously not a filled-in one, but just to give a sense of what's being looked for from nonprofits. And then you also talked about, getting to the point of regularizing the type of funding. So I'm wondering kind of what your vision is around that. So, what kind of timeframes would you be talking to organizations about? And is there a goal for a percentage of the addictions and mental health budget that would then become focused on community, or I guess transmitted through community-based organizations?
I recognize the honourable minister for Addictions and Mental Health.
Yeah, I think the goal would be to have, when the framework is complete, to have sustainable core funding on an annual basis, right, to these organizations. So I don't have the framework isn't complete yet, so I would be hesitant to give a budget value or a percentage at this point. But I think generally speaking, one of my priorities within the department is certainly to focus on community access for care, right? So whether that's the Boys and Girls Club in Chester and the Pier, or if it's in Yarmouth, right? Like I think they're undervalued historically in the province. So once that framework is complete, we'll certainly have specifics. But I would say that it will be much more significant than has been historically in the province, right? Because a lot of these were just one-offs historically. So.
I recognize the honourable member for Halifax Citadel, Sable Island.
And so I guess, not to belabor the point, but even for we've had 2 years now of significant funding provided to community-based organizations, and I assume that there is an accountability agreement in place, so maybe not the full framework. I am wondering if that can be shared, what's asked in the reporting from community partners. And I'm also wondering if the minister can table a list of contracts that are private-public partnerships, and also note which ones are pilots and which ones are permanent, if any.
I recognize the honourable minister for Addictions and Mental Health.
So that was a couple questions. I'll try to answer the first one. So the CBO piece, once we get the framework complete, we'll certainly have a very defined list. But I would say that even for organizations that receive like one-time funding, there would still be an accountability framework provided to them. I can certainly ask the department to provide the framework. In terms of pilots, there's a number of them here in the budget, ranging from mobile crisis to subcontracts with clinical psychologists. And then we have our sort of, long-term established services, right? So your inpatient mental health and withdrawal management and crisis intake, all these sorts of services, right? So I think the initiatives would be what I would probably reference to the pilots, both for the OAMH initiatives, the IWK initiatives, and they would be the two main ones.
I recognize the honourable member for Halifax Citadel Sable Island with 38 seconds.
Actually, Madam Chair, I was going to suggest a 5-minute recess.
Let's take a 5-minute recess.
Thank you.
Order. The Subcommittee on Supply will continue. I recognize, the time has elapsed for the NDP caucus, and we will now go back to the Liberal caucus. I believe the intent is to share some of the time through the Liberal and NDP caucuses, and then with the independent member. And with that, I will recognize the honourable member for Clayton Park West.
Thank you, mixed chair. And I have a couple of questions, but if I may just go back to that last question, what I didn't ask for that the 1 hour session, that is, I'm assuming it's a pilot. What is the timeline? When is it starting and when is it ending, so that we know when the evaluation, how many hours, what is the contract with them?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, mixed chair. So this, I announced the service was February 22nd, so a little over a month ago. So there's 4 physical locations in each 4 health zone. So the service is accessible for people in those 4 communities in person, but it's also accessible via telehealth and virtual health if you live in a rural or remote region in the province. So typically, any kind of evaluation process would be every quarter, right, within most frameworks. I don't have the details of the contract here in front of me, but I can certainly get the details and share it with you. I think it was it 20? Okay, I can check on the details of the contract though and follow up.
I recognize the Honourable Member for Clayton Park West.
Thank you. So it is, there's a beginning and an end for this contract, correct? It's not going to be every year for the 2.3 million?
Oh, sorry. I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, I would say that it's ongoing, right? I would be hesitant to say that we're going to do it forever without having the evaluation, right? So every number of months we would undergo the evaluation process to see if it's doing what it's intended to do. So the investment this year would be for this fiscal.
I recognize the Honourable Member for Clayton Park West.
So for this fiscal, so it's a 1-year contract for 2.3 million. Do we know how many hours that totals?
I recognize the Honourable Minister for Addiction and Mental Health.
Yeah, so this service would be for this year. So it would be for the 4 locations and the clinicians, the clinical staff, and like any other program, there would be a thorough evaluation done, right, to see if it will be continued. Because if it's not doing what it's intended to do, we would not support this service again, right? So I would certainly say that's the investment that was announced in February. So we'll continue to monitor the program.
I recognize the Honourable Member for Clayton Park West.
So if I could have that maybe emailed to me, it's the contract, the beginning, the date that is going to start, the date is going to end, and when the evaluation is taking place, please. And how much per hour is the cost? Is that 2.3 divided per hour that this company is going to provide? And you said, and if you don't mind as well, to how many of that is virtual? How many of those hours are going to be virtual, and how many of those hours are going to be in person in different locations? Just a breakdown of what this service is all about and how you came up with this idea and the contract. Okay, wonderful.
Oh, I recognize the Honourable Minister for Addiction and Mental Health.
So I'd say with any government service, there would be a request for proposal that would be issued, right? So that, for a service, so this would be go through the procurement process. So the dollar figure would be to administer access wellness across the province as part of the RFP process. So it's a package, basically.
I recognize the honorable member for Clayton Park West.
So there was an RFP, and so you have all the details of when the start of this program or this service, when is the end, and how many hours, and what's the cost per hour, correct? So if I could have that information, it'd be wonderful. So I'm glad there is an RFP and you have all that. So it'll be great to have that information. The next thing is I have, the Liberal caucus did a FOIPOP to obtain, to find out how many vacancies there are in the mental health, in staffing. And I'm wondering how many vacancies of mental health and addiction professionals are there? Do you have numbers of what you're missing and vacancies that are available right now to fill?
I recognize the honorable minister for addictions and mental health.
Yeah, we do. Do you want me to read through them all, or like I did before?
Sure.
Okay, sure, yeah. So registered counseling therapist, just the percentage here, yeah, 39%. Just the vacancy.
How many spots? How many positions? Full-time and part-time?
That'd be 114 for RCT. Psychology vacancy would be 36.4%, which equates to 60 FTEs, and then social worker vacancy is 22.4%, which equates to 248.
I'm sure it's on transit, this information. I wasn't able to write it fast enough. I have that as well. All right, the other question that I have is, we're facing an opioid crisis in this province, and I've heard actually from a couple of doctors who are working with mental health, and there is there's a treatment that the doctors can use, and it's available actually in Alberta and in PEI, but it's not available in Nova Scotia, and that is Sublocade, and it's a monthly injection that can prevent people who having to go every day to get medication. It's a life-changing for a lot of them, but it is at $200 per month per patient, and many of those people are who need it have no way of paying the $200 a month. So why, do you know anything about it, and why has Nova Scotia not covered this medication?
I recognize the honorable minister for addictions and mental health.
So Sublocade is covered on the formulary in Nova Scotia. So I was at the North Sydney for the example of the Pharmacy Associate of Nova Scotia is enhancing their scope of practice for primary care. So Sublocade is covered under the provincial formulary. It is covered, yes. And Dr. Ray Cox, who works in our office, is probably one of the leaders in addiction medicine in the province, and Dr. Martel from Lunenburg. So it is covered. So if you hear anything different from a constituent, we'd certainly be happy to connect you with the, yeah.
I will email you that we received it through an email, and it is not covered according to this person in Halifax.
I reckon, that's okay. I recognize the honorable member for Clayton Park West.
Thank you. And thank you again, yes. My next question, in the business plan, it states that there will be more mental health day hospitals opened, and I believe in your opening remarks you mentioned there is one in Halifax and one in Cape Breton. What is the budget for all the day hospital, and where will they be? And maybe you can just describe what services are offered in a day hospital.
I recognize the honorable minister for addictions and mental health.
So yeah, this the one we announced last year in Central Zone will be the first day hospital. There's one going to be opening in Cape Breton. We're still trying to confirm, I would say, the locations in the northern and western zones. So I'd say there's more to come with that. In regards to cost, it's about $1 million per day hospital. That doesn't include psychiatric services, so that's probably about another $360,000, give or take. So there's a few medication dispensaries, might be a little bit extra, but generally speaking. So in terms of service, you need a referral here from a primary care provider to this, attending psychiatrist on the unit. Then basically the treatment would be very similar to if you were an inpatient in a psychiatric unit, minus the fact that you would stay there overnight. So you'd be, pharmacology, right? So could be talking to social work for counseling, could be group therapy potentially. So there's a variety of services, but it's intensive treatment, right? So you wouldn't be intended to stay there any longer than you would need it to be without being clinically indicated to go to a lower tier service.
I recognize the honorable member for Clayton Park West.
Thank you. So right now, there's one in Halifax. I know I have a constituent who is trying to get help for her daughter, and there was absolutely no beds, or she wasn't successful at all to get her help for an overnight. So where is this one in Halifax, and how can I refer my constituent to this one?
I recognize the honorable minister for addictions and mental health.
So I would say day hospitals aren't overnight anyways, right? But a good place to start would be to contact intake if they didn't already have a conversation with their primary healthcare provider, if they have one. But I would contact intake, and they would navigate them through the process if that's what they needed. So I think intake would be a good starting point. You could also get a consult from if you're family doctor or nurse practitioner, right, to consult for if it's psychiatry that's needed. I don't know the specifics right of the case, but that would be the two routes that I would suggest.
I recognize the honorable member for Clayton Park West.
Okay. So I'm sorry, where is the hospital, the day hospital in Halifax? And she does have a family doctor, and she has a referral, but she has not been successful. So I will forward that email to you, to your office, and hopefully we can help her. But she is desperate for help, this mother, and I'm sorry, did you mention where this day hospital is in Halifax? Is it at the Abbey Lane? It's at the Abbey Lane. And you need just a referral from your family doctor, correct?
I recognize the honorable minister for addictions and mental health.
So that'd be the primary mechanism that I would use, but there's also I think 45 community mental health clinics across the province through Nova Scotia Health. These would be outpatient-based, right, community clinics with a variety of clinical kind of disciplines that would provide care. So I don't know the specifics of the case, but these are some of the options that we could maybe explore with your constituent, but I can't really say too much else.
I recognize the honorable member for Clayton Park West.
Thanks, you, Mixed Chair. This is a very complicated, and she's tried everything, and she has not received help at all. So we will forward that one to you, and hope if you can help us as well with that one. The other question. There is a commitment to spend $2 million more to expand virtual mental health care, and at the Nova Scotia Health and the IWK. When will this service start, and what are the hours for care? How do you monitor and quantify its success?
I recognize the honorable minister for addictions and mental health.
Yeah, so say when during COVID-19, the Nova Scotia Health and IWK with mental health services sped up the rollout of virtual mental health, not just for mental health, but I think for primary health as well. So we do have a pilot that was very successful in Eastern Zone for virtual mental health care in emergency departments, which that's currently being expanded in other regions of the province. So there is provincial virtual crisis and urgent care teams was implemented. So that was an increase of 3.8 FTEs. So that was in 22-23 to create this team. We're certainly, in continual conversations with our emergency room physicians and our crisis teams within emergency rooms. So that was those pilots were virtual urgent mental health care and EDs. Like I said, was launched in Eastern and now is expanding to Northern Zone. So they would provide virtual care in emergency room settings, which typically would have had to be transferred to another facility for a psychiatric assessment in person. So we do have 22 FTEs that have been dedicated to support virtual care from our community mental health and addiction services teams that I just kind of talked about that are all across the province. So all the uptake of the service volume would all be tracked, as well as with wait times and outpatient appointments. I think as of last month in February, there are 3 FTE vacancies which haven't been filled due to operational reasons. So I'd say generally speaking, the feedback's been very positive for the virtual, mental health care. Certainly some challenges with recruitment, as previously mentioned. So I think in 22-23, approximately 13% of all Nova Scotia health appointments were virtual appointments. So over 27% of appointments were conducted virtually during the third quarter across the IWK. So quite a bit higher for IWK services. So
I recognize the honourable member for Clayton Park West.
So virtual care, the total number of staff that we have right now, full-time, is 22, or is that 20? What is the 2 million, what was the expansion spent on?
I recognize the honourable minister for addictions and mental health.
So yeah, the 22 FTEs would have been in addition to the previous staff complement, specifically for virtual care across the province. Yeah.
I recognize the honourable member for Clayton Park West.
What was the total number of FTEs working in virtual care right now?
I recognize the honourable minister for addictions and mental health.
I don't have that with me right now, but I can certainly follow up with the number.
I recognize the honourable member for Clayton Park West.
Thank you, Mixture. I think I'm going to give my time to my colleague here
Okay.
from now. How
Okay.
many minutes did I use?
You used 20 minutes.
Perfect.
Can I just pause for 1 second though?
Yes.
So, does like the time get saved? So I will recognize the honourable member for Cumberland North with, I think, an agreed upon half an hour.
Thank you. Thank you, Madam Chair.
Mixed chair.
Sorry, mixed chair. Thank you, mixed chair. Hello, Minister. Good to see you. I have some questions. To start off, I'll start off a bit broader questions. How much money was budgeted for your office for the last year, the year that we're just finishing up?
I recognize the Honorable Minister for Addictions and Mental Health.
Thank you. The amount for my office specifically would be 191,000, but for the department, the estimate for 22-23 would have been 268,631.
I recognize the Honorable Member for Cumberland North.
Thank you, Mixed Chair. Thank you. So just for clarification, 191,000 or 191 million for your office and 268 for mental health in general. That would include the Department of Health and Wellness? Maybe I'll just ask the minister to clarify the numbers.
I recognize the Minister for Addictions and Mental Health.
So yeah, the general administration for 22-23 for the office itself would be 191,000, and the departmental budget for the Office of Addictions and Mental Health would be 268,631. That's million. Yeah.
I recognize the Honorable Member for Cumberland North.
Thank you, Mixed Chair. Over the last year, did your office receive any additional funds than what was budgeted?
I recognize the Honorable Minister for Addictions and Mental Health.
We didn't, other than the 22-23, which is the 20 million, which would have been for the healthcare retention within the staff within the formal mental health addiction system.
I recognize the Honorable Member for Cumberland North.
Thank you, Mixed Chair. Can the minister let me know, do you have a specific budget for the northern zone?
I recognize the Minister for Addictions and Mental Health.
I would say there's no specific budget for any zone, to be honest. I would say that there's an expectation from myself that there's equitable services in each health zone, right? So whether that's with the day hospital or whether that's with virtual care or community-based services, I would say each zone is certainly unique in its, geographical makeup or challenges, right? Whether it's rural or urban and that sort of thing. But I think underlying a lot of these new programs that we have announced, there is a goal that all Nova Scotians should be able to access the service, regardless of where they would live.
I recognize the Honorable Member for Cumberland North.
Thank you, Mixed Chair. Within the northern zone, Minister, can you share with us how many acute psychiatric beds would there be for the northern zone? So that would be Pictou, Colchester, and Cumberland.
I recognize the Honorable Minister for Addictions and Mental Health.
So this is the breakdown I have in front of me. I don't know if this answers your specific question, but I will just see if it does. So there's, as of April 2022, there's a total of 361 inpatient beds. So 164 would be acute beds, 74 would be specialty beds, 92 would be forensic beds, and 31 would be for withdrawal management. So in 21-22, there were a total of 4,616 inpatient stays across the province. So I don't have the specific bed breakdown, but we can make sure we follow up with you, for sure.
I recognize the Honorable Member for Cumberland North.
Thank you, Mixed Chair. And the reason I'm asking specifically is I believe there's only acute care beds in the northern zone at Colchester Regional. I'm wondering if the minister can confirm that, and if there are acute care beds at Aberdeen, let me know. And what would the occupancy rate be of the acute care beds for the northern zone area?
I recognize the Honorable Minister for Addictions and Mental Health.
So speaking from a provincial standpoint, typically the bed occupancy rate is quite high across our inpatient system across the province. Historically, it's been high since the central zone. That's why we chose there first for the day hospital, try to take that pressure off the system. I know historically it's been between 95 and 98% for the other three zones. We don't have the specific percentage for, I don't think, northern zone here, because we manage the inpatient bed system provincially. But there will be an expansion of a day hospital in the northern zone. I just don't know the location at this point, but we'll certainly have some information to share soon for that. Yeah.
I recognize the honourable member for Cumberland North.
Thank you, Mixed Chair. And certainly, you know, we've discussed this previously, that I would have guessed that the occupancy rate was high. Has the minister and the department considered increasing the number of acute care beds for psychiatric patients based on the demand? And the reason I'm asking that question is you know, we have had several continuing circumstances in our area where people are in need of psychiatric assessment and potentially inpatient psych services, but unfortunately there is no acute care bed available. And it's very stressful for the emergency team, the physicians and the nurses, and what often happens is the patient ends up not receiving the care that the medical practitioner would have liked, because there's no availability of an acute care bed and sometimes a psychiatrist. So what often happens is the emergency department staff simply end up just discharging the person back into the community without them receiving the psychiatric medical care. So based on that, and I don't know if the minister, if your office would have stats or any data on how many patients would be discharged home without being seen. I don't know if that's even captured, because it's not something medically, from a legal liability standpoint, that people would probably actually want to document. But I know from hearing from our medical practitioners, that is in fact the practice, unfortunately. So based on all of that, I'm wondering if there's been any discussion about increasing the number of acute care psychiatric beds, specifically in the northern zone.
I recognize the honourable minister for Addictions and Mental Health.
Yeah, there certainly has been increased demand, I would say, in the inpatient mental health system across the province the last number of years, for sure. I think the data from the day hospital in Central over the last year has been very significant. And I'll have it here in a second. So there was approximately 2,847 days spent in the day hospital. So it basically led to a 13% reduction in inpatient beds in the central zone last year, right? So I don't think it would be fair to say that would be the same for northern or western or eastern per se, but I do think there's potential there. It should have a significant impact on the inpatient system. I think there was also programs in the budget such as the mobile crisis, right, which will be another avenue to reduce pressures on the emergency departments. I think a lot of our services too are really focused with community-based organizations, right? Finding those kind of champions within the community that can really provide the lower tier services. But there's certainly a increased demand for non-urgent services across the province, which is increased. But I would say, generally speaking, it's something we'll continue to look at as we kind of move forward.
I recognize the honourable member for Cumberland North.
Thank you, Mixed Chair. Thank you, Minister. Yes, certainly, every time somebody's not able to access care, we're always concerned, but there's definitely a higher acuity of concern when people are in an acute state, when a medical practitioner, deems it necessary for them to have an acute care bed, and that's not available. So if, ideally, we would love it if there was someone looking at increasing the number of acute care psychiatric beds, and definitely in the northern zone. I know there's a demand there. Would the minister have any numbers on the usage for Nova Scotia patients on the psychiatric services, mental health services, both inpatient and outpatient in New Brunswick? So, for example, many of our patients of our community, when they're not able to receive care at our Cumberland Regional, they'll go to Moncton. And I'm often hearing anecdotally from patients about the superior psychiatric care that they're receiving there, that often they're seen and often admitted for at least 1 week stay, seen by a psychiatrist, versus trying to access mental health care through our regional hospital and are unable to see a psychiatrist and are unable to receive psychiatric care. So do you have any numbers? Would the minister have any numbers of how many people, how much money is Nova Scotia spending on sending money back to New Brunswick for those services that Nova Scotians are receiving next door in our neighboring province?
I recognize the Honourable Minister for Addictions and Mental Health.
So I would say in terms of meeting our crisis targets in Nova Scotia, like we do a pretty good job. Like it's not perfect for sure for mental health crises. Certainly been a noticeable increase in non-urgent issues. Typically non-urgent issues aren't seeing psychiatrists, right? That's typically for your higher acuity, sort of more complex care. We wouldn't have that information with New Brunswick. I would have some correspondence from my colleagues from constituent cases, right? Those sorts of things, but I wouldn't. We've had people come from other provinces in Nova Scotia too, right? For whether it's for ECT or different services, right? So I wouldn't have New Brunswick's information. Thank you.
I recognize the Honourable Member for Cumberland North.
Thank you, Mixed Chair, and thank you, Minister. Definitely, I know that information is available. It's maybe available through the Finance Department, possibly, but I think I'm not opposed to our people receiving care in New Brunswick, especially if it's not available to them here in Nova Scotia. On that note, has there been any work with our neighboring provinces of both Nova Scotia or New Brunswick and PEI to work collaboratively to ensure that patients receive services? Has there been any collaboration from your office or department with the neighboring province of New Brunswick?
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, I would say there's regular meetings with the FPT, right? The federal, provincial, territorial sort of representatives from each of those regions. I think when you see the recent announcement with Atlantic Canada with the licensure for physicians, right, to kind of cut down the red tape from whether you're in the United States or right, these sorts of things, I think it's a positive step forward. Certainly, I've had conversations with my colleagues in the other Atlantic provinces, and I think very interested to see what was in the federal budget today as well for mental health and addictions care, because we'll be taking a close look at that tonight. But those FPT meetings are certainly regular and ongoing, as well as conversations with the federal ministers. So, I mean, I'd be certainly open to any kind of, dialogue with my colleagues. Yeah.
I recognize the Honourable Member for Cumberland North.
Thank you, Mixed Chair. Thank you, Mixed Chair, and thank you to the Minister. And I believe certainly in Cumberland County we would benefit greatly from more collaboration with New Brunswick. And bottom line is we want to make sure that people receive the care when they need it, and wherever is the easiest access, I guess, is what's best for the patient. I want to just, before I finish on that note, I do want to just emphasize this is not anything new that I've brought up. I've brought this up before, but just to emphasize, we have a dire need for acute psychiatric beds in the northern zone. And I don't know if the minister would ever have time to come up to Cumberland, but to meet with specifically the emergency room physicians, because they are the ones, and the emergency room nurses, they are the ones that are faced with assessing a patient that comes in, but not having the ability to access those psychiatric services. It's really one of the only specialties, Minister. If they have cardiac event, there's internists that share a 24/7, 7 days a week call. We have radiologists that are on call 24/7. We have obstetricians on call for delivering of babies. We have surgeons, really just about every specialty. And although you could say there's a psychiatrist available 24/7 in Truro, the actual fact is when our emergency room physicians try and access, they're often told there's no bed available and they're not able to be seen. The patient is not able to be seen. So, and that is often comes after spending hours on the phone. So what the actual result of that is, in a very busy emergency department, often the emergency room physician will say, I don't have time. I don't have time to get on the phone and try to convince a psychiatrist in Truro or in another area of the province to take this patient that needs psychiatric care, and often the patient gets discharged home without receiving the care that they need. And the fact is, if it was any other type of condition, like cardiac, or if they broke their leg and they needed an orthopedic surgeon, there is a place where they could receive the care. But we're really seeing huge deficiencies in accessing acute. I'm talking about, very serious medical acute psychiatric care. So I just want to make sure that the minister's aware of that. And our psychiatrists, I would say, the ones that are serving our area, are aware of it to a degree, but the people that are acutely aware are the emergency room physicians, because they're the ones that are faced with the patient in need, and they just simply have nowhere to send the patient. So I wanted to move on to another topic, just to ask the minister about education. Is there any collaboration with the Minister of Education on trying to meet the mental health needs for students, specifically the psych ed assessments that I'm being told from parents there's about a 2-year wait time? And I'm wondering if there's any discussions with your department of the two departments working together to try to get students in much faster.
I recognize the Honourable Minister for Addictions and Mental Health.
So yeah, I guess a couple things with education specifically. So you look at Schools Plus, right, for example, and the youth health centers. I think they're mostly at high schools, right, in the province. We're also working together to develop a curriculum, right, with education that's well underway. So I know that's not far off. So in regards to assessments, so one of the pilots, the subcontracts with private clinical psychologists will be used for diagnostic assessments for autism spectrum or ADHD, for your wait list for EIBI, for example, right? So typically your preschool, elementary sort of chronic issues. I know we've given education some increased resources for education or mental health literacy, both for staff and students as well. We have seen an increase utilization of the health centers at the schools, right? Usually with nurses and social workers. Most of the increases with mental health and sexual health has been the two kind of big things that have increased the last couple of years. So we're always looking at is that the appropriate number of FTEs in the school system, right, and these sorts of things. So I think there's a variety of partnerships with education, because historically, if parents can't get the diagnosis, they can't afford to pay for the private diagnostic assessment, right? So we're kind of trying to pull that into the public sector with our private partners. So they've been very receptive so far, I would say. Some may be working both private and public, right? Depending on what their professional desire is, really, right? So those conversations are certainly ongoing. We do have an actual map with where every psychologist is at in the province too, which I think is right. There's a lot of potential for virtual care, but sometimes it doesn't work for everyone. So I think there's a number of things with education that we, certainly are keeping an eye on. I would say the elementary school system is somewhere I've identified there's been probably a lack of mental health resources, so certainly some collaborative conversations going on there. even with food security and how these things impact, right? So certainly some conversations are definitely ongoing.
I recognize the honourable member for Cumberland North.
Thank you, Mixed Chair. Thank you, Minister. I think in New Brunswick, what I'm being told is that all of the psych ed assessments are being done by private contractors, and it's helped to shorten the wait list for whatever reason that they've. So I don't know if the minister's aware of that or wants to speak to somebody in our neighboring province to see how they've done it, but I guess they've really shortened the wait list there. But it is definitely an identified need that's come up through our office in Cumberland. The minister mentioned one area around the increased demand for sexual assault counseling, and lose track of time. It was definitely pre-COVID. The former CEO, Dr. Kevin Orrell, he actually allocated a significant amount of funding for sexual assault counseling, not within schools, but within Cumberland, because we had he was aware of some very high profile and some large number of victims, I guess, from sexual assault. And we don't have any specifically sexual assault counselors in Cumberland. We have Autumn House, which is a place for women can flee from family violence, but there are no specific counselors for sexual assault. And at that time, Dr. Kevin Orrell did look for community partners that would be able to take this funding and make it very clear that people could go to a specific center for sexual assault counseling. Unfortunately, he was not able to find a partner. So that money ended up just getting sort of folded into the Cumberland mental health budget, but the people in the community didn't know that. So, and there was really no advertising that you could call. And if people was a victim of sexual assault, they would just call the regular number. There was nothing identified that there was specific funding there for that. And I'm wondering if that's something that the minister, if your office would be willing to look at, because I don't have the data in other areas of the province, but I can assure the minister that there's been a large number of victims that have not come forward to police because of fear of public persecution, fear of shaming, all those factors, but they are in desperate need of counseling and of support and of healing. And I'm wondering if the minister might be able to dig into that a little bit to see where that money went. And since I've spoken to a couple of the community partners who might be willing to be that nonprofit support organization that could make available these counseling services for sexual assault victims.
I recognize the Honourable Minister of Addictions and Mental Health.
Yeah, it's certainly something I would be looking into. I wasn't aware of Kevin and that funding, to be honest. So I do think last year we did announce a new sexual violence trauma therapy provincial-wide program. Although that's kind of being led by Avalon, there's clinicians that actually work, in Colchester and Antigonish and these different places that are still going to be part of the new program. I think the same program specifically through Nova Scotia Health, right? So they have some highly trained clinicians that usually work in the hospital system, right? So I can certainly have a conversation if we can find hopefully community-based organization in the area, if we can, right? So certainly something I'd be open to looking at. And I think something I've seen too, different regions of the province is the human trafficking is a real issue in Nova Scotia, right? So whether it's in the Tri-Counties or Northern Zone, Nova Scotia has a real problem, I think, probably in that regard, right? So I know the folks at Justice are working on that as well, but with the counseling piece, if we can certainly do what I can to help with that, for sure.
I recognize the Honourable Member for Cumberland North.
Thank you, Madam Chair. Thank you to the minister for that, and certainly we can connect the minister with some local nonprofits, and it would be great to have more support for these victims in our community. And I can't remember the exact number, but it was a large amount of funding, and I don't know if it continued, if it was just for that 1 year, but it was very much appreciated, but I don't think it actually got to the actual victims because of the lack of the ability to find a local partner. And victims that do come forward, there is a counseling center in Truro, but the fact is not a lot of people are able to travel that hour and don't have the transportation available to go there. And my last question for the minister is more targeted around psychiatrists, and I'm wondering if the minister could answer a couple of questions around what is the funding allocation for psychiatrists, specifically to Cumberland County Regional. I was a little surprised that the last recruitment committee, retention physician committee meeting that I went, that they actually did not have psychiatrists on their list of physicians that they were working to recruit for, which I was surprised by that. And I'm wondering if anyone is working on recruiting more psychiatry for the Cumberland mental health team.
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, so I've had a number of conversations with the zone medical lead and the chief of psychiatry for that zone, so it's certainly something on their radar. I don't have the specific number here, but I know there's a in each 4 zones there's a dedicated FTE allotment, and there's an expectation that there's money there to fill those FTEs until they're filled. So it wouldn't be for lack of trying or lack of resources or funding available. Yeah, surprising to hear that it wasn't brought up at that meeting for sure. So. But I know in conversations with the chief that there was, they were discussing a number of positive people coming to the area at that time. This was probably about 6 months ago that I would have met with the chief there. But there was some positive momentum, I would say, in recruitment for that zone specifically. I'm not sure if it was Cumberland, but I know from a primary care and psychiatric care, it's certainly something that the team is looking at.
I just want to confirm that the member for Cumberland North is finished with her questioning. Okay, thank you. Then I recognize the Honourable Member for Halifax Citadel, Sable Island.
Thank you very much, Madam Chair. In the $17.7 million that was allocated for furthering universal mental health access, there was $562,000 allocated for MAID. And I'm wondering what that's for and what specifically will be done this year, because, of course, the federal government has decided to delay the enhanced provisions of MAID for a 12-month period. So, yeah, what is that allocation for?
I recognize the Honourable Minister for Addictions and Mental Health.
So this specific amount would be to help address increased demand for MAID for non-mental health issues in the province. We've certainly been following the federal situation very closely, and the Canadian Psychiatric Association telling them to slow down, which I'm glad that they did, right? So we have to be ready, though, as a province, depending on what the federal government does. So we'll continue to monitor that, but that specific number would be for MAID for non-mental health, to increase demand in the province. Yeah.
I recognize the Honourable Member for Halifax Citadel, Sable Island.
I'm sorry, Minister, can I ask you to repeat that answer, what the 562 is for?
I recognize the Honourable Minister for Addictions and Mental Health.
So this would be that there's a high demand for MAID in the province, not for mental health. This would be to help keep up with that increased demand.
I recognize the Honourable Member for Halifax Citadel, Sable Island.
So is it FTEs? I'm wondering specifically how that money is being used to respond to the increased demand.
I recognize the Honorable Minister for Addictions and Mental Health.
So yeah, this would be for FTEs. So there'd be 8 FTEs in total. So it'd be 2.5 for a nurse navigator, 2 for a nurse practitioner, 1 for a mental health nurse, 1 for a social worker, 0.5 psychologist, and 1 for a clinical lead. So it'd be for clinical staff.
I recognize the Honorable Member for Halifax, Citadel, Sable Island.
So given that staff component, I mean, it sounds to me like a team. So is that team responding to made requests or analysis or assessments, I guess, being asked, demanded across the province, or how is that team working?
I recognize the Honorable Minister for Addictions and Mental Health.
So this would be a provincial team offering services across the province.
I recognize the Honorable Member for Halifax, Citadel, Sable Island.
And can you describe a bit about how they're going to work? So will they be available virtually, or like the navigators, will they be providing in-person services, or how's that all going to work?
I recognize the Honorable Minister for Addictions and Mental Health.
We wouldn't have that. I don't have that information here with me, but I'd be certainly happy to follow up with the member. Yeah.
I recognize the Honorable Member for Halifax, Citadel, Sable Island.
As well, in that, from that 17.7, there was 1.2 for trauma-informed care through the IWK. This has been a fairly long-standing commitment from the IWK. So I'm wondering what the new allocation of an additional 1.2 million is being used for in this fiscal year.
I recognize the Honorable Minister for Addictions and Mental Health.
So yeah, I think the member mentioned that back in 2015, the IWK did kind of start its process of becoming a certified trauma-informed care, organization. So part of that is developing a comprehensive training series, looking at their own current policies and how to improve them. So for the specific 1.9 million to support trauma-informed care, so this will create a provincial system where trauma is recognized and addressed that can better meet the needs of clients, family, staff, physicians. So I guess 3 of the main objectives would be to increase trauma-informed education and training across our service delivery providers, provide a comprehensive framework and support system for staff and physician wellness as well. So also looking at the trauma-informed lens, looking at the staff too, right, not just the patient population. We're really trying to do a better job too of strengthening engagement with community partnerships, whether that's with vulnerable populations or other important members of the community.
I recognize the Honorable Member for Halifax, Citadel, Sable Island.
So again, it sounds like some FTEs, particularly to offer training hours. The community partnerships, will there be direct transfers to community partners from this funding?
I recognize the Honorable Minister for Addictions and Mental Health.
Thank you. Yes, it looks like it's primarily for clinicians, FTEs, ranging from clinical educators to social workers to zone leads to wellness coordinators. I don't have the specific information in these positions, if they be with people with lived experience, those sorts of things, for example. I'm sure we could find that out. But the total would be 15 FTEs would be the total for that.
I recognize the Honorable Member for Halifax, Citadel, Sable Island.
And maybe I'll ask one more follow-up on that one, and then we'll continue on. So is that a permanent increase of 1.2 million a year in trauma-informed care for the AWK? And then as well from that 17.7, there was 441 allocated for African Nova Scotian children and youth mental health. And I'm wondering if you can tell me or us a bit about that project.
I recognize the Honorable Minister for Addictions and Mental Health.
So the first question is yes, it is permanent, yeah. And so the second question surrounding the 441. So this is under the IWK initiatives. So I mentioned in my opening remarks about the vulnerable Nova Scotians who has historically had difficulty accessing services. So this would be involve having Afrocentric services delivered by representatives within their community as part of the universal mental health care framework. So we've had consultations with 92 different members of the African Nova Scotian community, from virtual platforms to community visits. So some of the stakeholders that we would have met with throughout this process would have been the African United Baptist Association, the Association of Black Social Workers, African Nova Scotian Educators, Nova Scotia Brotherhood Initiative, community mobilization teams, a variety of young children in the community ranging from the age of 12 to 30, African Nova Scotian elders and African Nova Scotian clinicians. So kind of throughout these consultations, a variety of, I'd say, key topics came up, inclusiveness, representation, and continuity of care within the community. So the idea is to let the community lead this relationship and actually set up a clinic within the community, staffed by individuals of African Nova Scotia descent and within the community. So I guess a number of the key functions for this service would be enhancing services for the African Nova Scotian community, improving engagement and flow for African Nova Scotian patients, and building cultural capacity and competency within the community, and hopefully build trust, right, with service delivery.
I recognize the Honorable Member for Halifax Citadel Sable Island.
Thank you very much for that. I'm actually going to pass the questioning to my colleague from Cape Breton Centre, Whitney Pier.
Recognize the Honorable Member for Cape Breton Centre, Whitney Pier.
Thank you, Madam Chair. My first question to the Minister is, what are the Cape Breton mental health wait times for first visit?
I recognize the Honorable Minister for Addiction and Mental Health.
Yeah, so I think Nova Scotia was the first jurisdiction, I believe, in the country to start publicly reporting on mental health addiction wait times, both from a non-urgent and urgent perspective. From an urgent perspective, across all 4 health zones, we do meet the target within 7 days of treatment. And just for clarification, too, the urgent is not crisis, right? So crisis is different than urgent, so crisis would be seen immediately. So 98 days right now for non-urgent and Eastern, which is an improvement from 126. We do have the, excuse me, the acute mental health day hospital that's slated to open in Cape Breton this spring. So speaking to kind of senior leadership there, everything looks like it's going really well for a timeline. Recruited 3 psychiatrists too, which is the first time in probably 10 years that there's people coming there instead of leaving for psychiatry, which is good. Certainly challenges with non-urgent wait times for both kids and adults. So this is something that I think the Integrated Youth Services expansion should help with. So yeah.
I recognize the honorable member for Cape Breton Center, Whitney Pier.
Thank you, Madam Chair. Could you tell me what the average length of time it is between the first visit and second visit for mental health in Cape Breton?
I recognize the honorable minister for addictions and mental health.
Yeah, so typically with non-urgent appointments, specifically, I think that's what you're referring to. So typically the first choice appointment would be a long, extensive assessment, essentially with a clinician and a individual. So we wouldn't have, I don't believe, the data from the first to second, but I can certainly follow up to see if I can get it for you. Yeah.
I recognize the honorable member for Cape Breton Center, Whitney Pier.
Thank you, Madam Chair, and I appreciate that, if you can get back to me with that. My other question is regarding youth and mental health. Has virtual mental health through the IWK been implemented at the regional hospital or being looked at?
I recognize the honorable minister for addictions and mental health.
Yes, there's been I'll just use an example, Dr. Vera James. So she's a child adolescent psychiatrist up here in HRM, but she does locums in Cape Breton. She doesn't physically see the kids at the hospital. She sees them in Sydney at an office off Charlotte Street, I think it is. So she does a variety of virtual appointments with kids across the province from her office, but then for the more acute patients, I guess you would say, she'll come to Sydney to do the assessments. I think she's the first child adolescent psychiatrist we've had in a long time. I don't know the date, but it's been a long time, like over 5 years for sure. So, which is good. So I think it's been really positive, the feedback with virtual care. Certainly not for all kids, but certainly been beneficial for most that I've heard from families. So that's ongoing right now. They wouldn't be doing that physically at the hospital. They'd be doing that almost like an outpatient kind of clinic kind of setting in Sydney. But she does do locums though. Yeah.
I recognize the honorable member for Cape Breton Center, Whitney Pier.
Madam Chair, my question is, I'm just wondering, because we mentioned either she's a psychiatrist or a psychologist, I'm just wondering how many psychiatrists and psychologists do we have in Cape Breton that specialize in youth, or is she the only one?
I recognize the honorable minister for addictions and mental health.
Yeah, I wouldn't have that in front of me right now. And psychologists, like we have I think, very good understanding of where most of them are, but not every single one of them. Like typically, they're all regulated through their regulatory body. But we can certainly see if we can find that out. But I would say there's an adolescent and outreach outpatient mental health service in Cape Breton too, which would have its leadership team, right? And they would probably have a lot of metrics in that data. So I can certainly check with Nadine to see what I can find out with that.
I recognize the honorable member for Cape Breton Center, Whitney Pier.
Thank you, and forgive me if this was already asked. I wasn't here for the whole thing. I'm just wondering how many, outside of adolescent and youth, how many psychiatrists and psychologist vacancies are there in Cape Breton, if any?
I recognize the honorable minister for addictions and mental health.
Yeah, we can get the zonal breakdown, but just speaking, having worked there for a number of years, probably 8-9 years ago, we had, I think, maybe 15 or 16 psychiatrists in Cape Breton. When I left, so we had 6. I think we had 2 from the UK and 1 just came from Egypt, so we're back up to 9. So I'm not sure, not doing the math, but typically there'd be some more FTEs that needed to fill. But there's been 3 new hires. We do have a new hire for the day hospital too. So I'd say it's been very positive momentum. We had, I think, 5 clinical assistants there too. So they would be, they can essentially do almost everything that a psychiatrist can do, except to deem someone voluntary when they're involuntary. So they can do call schedule, they can do medication, pharmacology. They see people on the unit. They can do most of what the psychiatrist can do. And for whatever reason, they can't get full licensure in Nova Scotia or Canada sometimes, but they've certainly been a big asset, I would say, to Eastern Zone for sure.
I recognize the honourable member for Cape Breton Centre, Whitney Pier.
How much time do I have?
So it is 7:17:28, so we're looking at 29 minutes and 30 seconds.
Okay, thank you. This is my last question I actually have, and then I'll be passing it on to my Liberal colleague. This past year, we saw BC was granted the exemption to the Controlled Drugs Act in a move to decriminalize drug possession. I'm wondering if the minister could provide an update on safe supply and decriminalization work.
I recognize the honourable minister for Addictions and Mental Health.
Yeah, certainly something we're keeping a close eye on, I would say, in British Columbia. I think that their exemption actually just started to take practice in this January, right? So it's very early days, I would suspect. Certainly something we'll keep a very close eye on. I would say that we do have a variety of harm reduction services, right, in Nova Scotia. We have 2 overdose prevention sites, one here in HRM, one in Sydney. We've more support for them here in the budget, ranging from needle exchange programs to managed alcohol programs. So we'll definitely keep a close eye on that. We have a very, compared to other jurisdictions, I would say we have a very strong opioid framework across the province in terms of clinical services. I know that was a significant piece of work with Dr. Hickox and Samantha Hodder and the rest of the team over the last 5-10 years. To real shift the community-based service, right, for people. So we'll certainly continue to support harm reduction services, whether that's the naloxone programs. We do have a new service too starting this year within the hospital system, where if someone's being seen in the hospital, they actually have the ability to refer to an addiction medicine specialist for the first time on a consult basis. So that's also new. So certainly we'll continue to monitor that to see how it's going, but I think you need to have that strong foundation of clinical services. With otherwise decriminalization, we'll see what happens. Yeah.
I recognize the honourable member for Cape Breton Centre, Whitney Pier.
Just to do a follow-up on the decriminalization. So is it safe for me to assume that there's no work being done to decriminalize drug possession in Nova Scotia from your office?
I recognize the honourable minister for Addictions and Mental Health.
Yeah, we have no formal requests to the federal government right now. Thank you.
I recognize the honourable member for Cape Breton Centre, Whitney Pier.
Thank you, Chair. And just to formalize this, I will be giving the rest of our time to the Liberal member.
I recognize the honourable member for Bedford South.
Thank you, Madam Chair. Thank you to the member for Cape Breton Centre, Whitney Pier.
Yes.
Correct. Yeah. For the generous offer of the time. So thank you to the minister and staff for being here. I know we're into the waning hours of what's been a long afternoon, early evening. I appreciate that. But I did have a few questions I wanted to touch on here. Last year, Minister, you stated that there had been an investment of $433,000 into a gambling strategy for prevention and treatment of gambling harms that can result from gambling. And I'm just wondering if this investment has been made, what kind of impact it has had. Are there any metrics or tracking to assess how well it's working? Because in my view, I think that gambling addiction in particular can be a bit misunderstood and not quite as open, or folks might not be as willing to discuss that as they would, say, alcohol or drugs, for example. So I'm wondering, how has that investment been made and what kind of impact it has had over the last year? Thank you.
I recognize the honourable minister for Addictions and Mental Health.
We'll try to track down the specifics of that question right now, but I think it's also worth talking about the recovery support centers, because they're specifically geared not just for substance use, but also gambling supports, right? So we've opened a number of them. The expansion will continue across the province. There'll be 10 in total, right, as things kind of continue. I think there's gambling can be quite stigmatizing, I think, right, to seek treatment sometimes, right? So I think these recovery support centers are good because like the one in Dartmouth, for example, you can just walk in off the street, right, if you want to. And I do think there's been significant uptake with Tranquility and these other online applications, and I don't have the data to support this, but typically that'd be a very good anonymous way to seek help too, I think, for a variety of mental health concerns. Certainly concerning to see the prevalence with sports betting, right? And if you watch it, it's just increased in our culture. So certainly something we'll continue to keep an eye on, but I will try to find the specific answer to that question.
I recognize the honourable member for Bedford South.
Thank you, Madam Chair. And the minister actually kind of touched on my next question there, which is the really rapid rate in which sports betting in particular has taken off. I love sports. I watch something pretty much every day, and it's hard to get through a commercial break without something for DraftKings or FanDuel or all these different groups, right? And I imagine it would be very, very difficult for anyone who's dealing with any kind of gambling addiction to see that on a constant basis. And for such a long time, that was such a taboo. There was nothing worse than gambling on sports, not just within the sport, but it was illegal just about everywhere. And now, just in the last couple of years, that's changed dramatically. So how does the department, the office, how do you manage that when there's another arm of government, of course, through Atlantic Lottery and so on, that deals specifically with gambling in that sense? So how do you, I guess that's a bit of a two-part question, but how do you deal with this increased prevalence of gambling within society at large, and how do you balance that with other elements of the government that are actively involved in that business? Thank you.
I recognize the honourable minister for Addictions and Mental Health.
Yeah, so I think with what happened in other jurisdictions, especially with single game sports betting, that's kind of where a lot of this, I think, probably started right from. I've had a number of conversations with the Minister of Finance, for sure, about the regulated online gambling here. I think historically there's hundreds of non-regulated gambling sites that people could have access to. So I think my input and my role would be to ensure that if people are using it, there's adequate resources on the website, contact information, supports, reminders, education, mental health literacy, and these sorts of make it as safe as it can possibly be, right? As far as in terms of regulated option, I guess, right? So I think it's very challenging, though. There's certainly challenging, right, with the way the culture is, right, going now. But I think, I always, as a former clinician, someone that's in this role, I certainly always come at it from the angle of I worry about people. I want to offer them support, right? But so I think with the recovery support centers and Tranquility, we do have a lot of options that people can seek help if they do need help. I know Dr. Haycox, we've had a number of conversations about this in terms of addiction tendencies in Nova Scotians, so certainly those are ongoing for sure. But I think that's certainly that's on our radar for sure.
I recognize the honourable member for Bedford South.
Thank you, Madam Chair. Thank the Minister for that response. We know that the School of Medicine at DAL has also added addiction medicine training to the curriculum, and doctors are helping to train medical residents at the Ally Center of Cape Breton's Collaborative Clinic. This is a great initiative. We'd like to see this expanded as well. I'd like to ask the Minister if there are plans to continue to expand this program in this coming year and then beyond as well.
I recognize the honourable minister for Addictions and Mental Health.
Yeah, I would say the CEO of the office is an addictions and specialist in primary care as well. Certainly, the addiction medicine specialists are hard to come by, right? There's not a lot of them across the province, and Dave Martel is another excellent, because he's one of the leaders in the country with addiction medicine. Some of them I talk to quite frequently. He's from Lunenburg. He does a variety of leadership roles in Canada for addiction medicine. So certainly something we would do to support in any way that we could. Wouldn't be a specific dollar figure I could give you right now, but there will be a new service within our healthcare system where primary care providers can consult to an addiction medicine specialist, right, within the healthcare system, which is new. Because I don't think the average primary care provider realizes the complexity sometimes of people coming into hospital for surgery that aren't forthcoming on their pre-op checklists, and they're withdrawing after surgery, and these sorts of things happen more than people think in the hospital setting. So certainly something we'd be willing to support, but I wouldn't have a specific dollar figure with that today.
I recognize the honourable member for Bedford South.
Thank you, Madam Chair. Thank the Minister for that response. And I'm going to go to something that I'm sure was asked earlier, so I apologize in advance for being repetitive. But it's useful for me, I think important as well. So just wanted to ask around the universal mental health care program. At the time, great concept, certainly was something that's attractive to lots of people. There are countless people who are dealing with either mental health issues themselves personally, or have a close family member or friend, of course, who's dealing with it as well. So I can understand the excitement and the interest around the program, and I felt the same way as well. And so I'm just curious if the Minister could just update us on when we might see that program in effect, and what that would really look like. Like if you're a person dealing with a mental health issue and universal mental health care is in place, what does that actually look like, I guess? Thank you.
I recognize the honourable minister for addiction and mental health. Yeah,
so I think at a high level, it's every Nova Scotian would have access to high quality care regardless of their ability to pay, right? That's at the core of it, right? So I think if you look at the increases in the budget, which get a lot of scrutiny, which is understandable. That's what I'm here to answer questions for, right? So, so $65 million in the first two budgets. So there's a variety of pilots in this budget specifically. The subcontracts with private psychologists, Dalhousie Clinical Psychology Training Program. We're going to start looking at the billing codes aspect, right, to bridge that private-public intersection. But if you look across the continuum of care, right, it ranges from your peer support telephone line to your acute mental health hospital inpatient setting. There's lots in between. There's lots of going forward and going backward, right? So I think as we kind of scale these up, whether it's mobile crisis, whether it's having clinical psychologists come in to publicly do assessments for autism spectrum, that's the families don't have to pay for. It's increasing access and getting rid of those gaps that have historically existed in the province. There's certainly challenges, whether it's with human resource, whether it's with rural regions, right, of the province. It's a very difficult task. There's I never really disputed that. So we are certainly seeing a lot of things now, I think, in the province that we haven't seen before. And that's just not me tooting my own horn, but it's a fact, right, to be honest. So even something like expansions of mental health day hospitals, recovery support centers, all these things lead to universal access, right? It's not like a light switch. You're not just going to, right? Like, this is a cumulative impact that will take a number of years to implement, right? But specifically with budget increases, with billing codes, this stuff will all be happening within the next fiscal, and people will see I think, the meat of what they want to see, hopefully.
I recognize the honourable member for Bedford South.
Thank you, Madam Chair. Thank the Minister for that. I am curious about the billing codes and I guess the cost calculation of this too, because I'm certainly no expert on this kind of thing, but in my mind at the time I was thinking, well, if you're a private psychologist or psychiatrist and you charge $150, $200 an hour, whatever the case might be, and someone's going to come through the universal program, and presumably the vast majority of people don't have the means to pay that by any means. So I assume then the model is that the government will be picking up that tab if and when, I shouldn't say if, hopefully when this program is operational. Is that the idea?
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, so the billing codes with mental health clinicians specifically is a new concept, right, for the province. Typically, you'd have your primary care provider, your GP, like a dentist, for example, could do the fee-for-service kind of model, right? So we're taking the shadow billing, which is a pretty well-established mechanism in healthcare for other providers, and applying it to these providers, essentially, right? But at the end of the day, the people won't have to pay for the service. So that's the gist of it, yeah.
I recognize the Honourable Member for Bedford South.
Thank you, Madam Chair. I just wanted to ask about the a program that was started under the previous government, the Bloom program, which at the time was the first of its kind in Canada and was designed to increase and improve mental health and addictions care for Nova Scotians. Right now it exists in 47 pharmacies. I'm just wondering if there are plans to expand that list, and how much is allocated in this budget for this particular program. Thank you.
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, I've had a lot of positive feedback, especially from a couple pharmacists in Cape Breton specifically, who speak very highly of this program. There's nothing allocated in this specific budget, but it's certainly something I would be open to considering. It's certainly a very positively viewed program.
I recognize the Honourable Member for Bedford South.
Thank you, Madam Chair. So just to clarify, Minister, my apologies. There's no funding allocated, no new funding, I guess, allocated for this program in this particular budget?
It's not working.
I recognize the Honourable Minister for Addictions and Mental Health.
I believe that's with the Department of Health and Wellness, within there, because it's with pharmacy specifically, but we can certainly make the connection with that department and follow up. That's okay.
I recognize the Honourable Member for Clayton Park West.
Thank you. Yes, actually, just to continue on that same, I met with the pharmacist who's doing it in Clayton Park, and apparently the uptake has really gone down because they're not paid very much for it. I had all the information that I don't have it with me, but they're only paid a very small amount per month, and the intake for this program has gone down, and the pharmacists are now, with the increased scope, are so busy that they don't have the time for this. For the amount of money that we are paying them, it is not worth it for them. So that's what I got from it, and she's happy. She's done it for a few years, but it's on the decline and is not doing as well just because the pay for it is just not worth their time. They're overworked, they have too much on their plate, and this one doesn't make sense financially for them.
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, I believe this is with the Department of Health and Wellness, but we can certainly take that to my colleague and follow up.
I recognize the Honourable Member for Clayton Park West.
Okay, the last question, I guess. So the government's creating a new advanced certificate program for mental health and addiction. Can the Minister please let us know when will that start? How long is the course? And is it offered to all nurses? How is that being distributed, the education path?
I recognize the Honourable Minister for Addictions and Mental Health with a reminder that we have a hard 4-hour stop at 7:46.
Yeah, so that would be a graduate program, so they're graduate studies faculty. So I think they already offer 2 streams already. So one would be the nurse practitioner stream. The other, I think, is the thesis-based stream. So this would be a 3rd stream. So typically, most criteria for graduate nursing programs, you need your undergraduate nursing in good standing with the College of Nursing within Nova Scotia. So other than that, it would be up to the institution, I guess, to dictate the admission criteria. I'll double check with the start date for you, though. Yeah.
I recognize the Honourable Member for Clayton Park West.
So we don't know how long these courses are, and it's offered just at the nursing school at Dalhousie, correct? Who prepared the curriculum for those courses and how long they are? And do the nurses, once they take this, do they get an increase in pay, or why would they, what's the incentive for nurses to take this?
I recognize the Honorable Minister of Addictions and Mental Health.
So yeah, the Faculty of Nursing at Dal has been asking for this program. So typically most graduate nursing programs are 2 years of duration. So when they graduate, there's different classifications of nurses, you know, RN2 up to RN6, I think. So there would be a little bit of a pay increase depending on your classification. So you would be getting increased, I guess, salary based on your increased education and qualifications.
I recognize the Honorable Member for Clayton Park West.
How long do I have, Madam?
Well, we have a hard stop at
Yeah. Oh, I understand.
7:46.
Oh, so we have to, yeah. All right, so I'm just trying to understand this, how it came about. So it's Dalhousie who came to you and wanted to offer this as part of the curriculum, or this is for other nurses who can come back to school and to upgrade? How is it going to be offered?
I recognize the Honorable Minister for Addictions and Mental Health.
Yeah, so I would say this would be for any nurse who wants to advance their education with addictions and mental health care. I know that Dalhousie, Nova Scotia Health, and the IDWK, in partnership with Advanced Education, have had a number of conversations with us as well. So I'd say it was a collaborative partnership, and the actual health authorities, Nova Scotia Health and IWK, actually identified it as a need to increase clinical capacity within the system.
I recognize the Honorable Minister for Clayton Park West. Or not Minister, sorry, Member.
Thank you, Madam Chair, for the, yes, thank you. Promotion, I should say. So I'm just going to keep it up just for the few minutes that we have left. Just to understand, this certificate is, Dalhousie came to you, and is this in the budget this year? What is the cost of this certificate?
I recognize the Honorable Minister for Addictions and Mental Health.
It is in this year's budget. It's 306,000. 306. Yeah.
I recognize the Honorable Member for Clayton Park West.
Thank you, Madam Chair. It's definitely worth it. I'm just hoping that it is, so, you're going to give me how long is this course, and as many of the nurses who can take it. I think it would be an amazing thing to encourage as many nurses in the past who graduated to upgrade, because mental health is so important. So I don't know how well are we promoting it so that they get this.
I recognize the Honorable Minister for Addictions and Mental Health.
Yeah, so I think the program is the start is between 6 and 10 students, but the goal, I think, is to actually expand it to 20+ students in the future years. So I certainly would agree that there's definitely a need there, and certainly something we'll be looking at for sure.
I recognize the Honorable Member for Clayton Park West.
Just to say thank you to the Minister for answering all the questions. We bombarded him, and thank you, Madam Chair.
You're welcome. With that being said, we have now 5 minutes, and I would like to hand it over to the Honorable Minister of Addictions and Mental Health for his closing statement.
Sure. Yeah. Thank you, everyone, for the thoughtful questions. Actually, it was very. It feels good to be in the hot seat because it forces you to know your department, right? Which I think is important. So it's good. So I'm going to keep it short and sweet and just read my resolutions on the estimates, if that's okay. So I'm going to read E16 for Communications Nova Scotia first. So be it resolved that a sum not exceeding $7,189,000 be granted to the Lieutenant Governor to defray expense in the respective Communications Nova Scotia pursuant to the estimate. And resolution and estimates for fiscal year April 1st, 2023 to March 31st, 2024, E27. Resolved that a sum not exceeding $306,855,000 be granted to the Lieutenant Governor to defray expenses in respect of the Office of Addictions and Mental Health pursuant to the estimate. Thank you.
Thank you, Minister. I appreciate that, and your staff. Shall the resolution stand? Yes. The resolution is stood. Oh, shall the two resolutions stand? Sorry. Yes. The two resolutions are stood. I would like to thank you, and with that, the time is now 7:43. That concludes the subcommittee's consideration of estimates for today. The subcommittee will resume consideration when the host again resolves into a committee of the whole on supply. Please return to your seats in the legislative chamber. The committee of the whole must rise and report before the host concludes its business for the day. Just hold on. Oh, I would like to mention one more thing. We are about 15 minutes ahead of the legislative room, and so you have 15 minutes to cross the road.
Stop for 15 minutes.
Was there? Yeah, very good.
Go YouTube it.
Adjourned.